Good evening and a hearty welcome to everyone. Team Ayur Apta presents national level paper and poster presentation to you all. So without much delay, we can start the presentation. And before that, I would like to invite our panel members. So first, I would like to invite our Akshata panel, Dr. Ashwari S, Dr. Veeranath, and Dr. Revdi Raj. Next, I would like to invite Swasthavrta panel, Dr. Sujitra, Dr. Rashmi R, and Dr. Sridevi. Next, I invite Prasulchandra panel, Dr. Deepthi, Dr. Srilakshmi, and Dr. Krishnapriya. Next, I invite Kaumarapatya panel, Dr. Aditi Dinashekar, Dr. Sulada Nandakumar, and Dr. Rajneesh. Next, I would like to invite our Kaitil Star panel, Dr. Ramesh P, Dr. Bhagya Soman, and Dr. Kavita Raj. Next, I invite Shala Kitundra panel, Dr. Vilendra Pupale, Dr. Vaishak Raj, and Dr. Arya K. Panikar. Next, our Deviguna panel members, Dr. Vishwanand Patil, Dr. Sridega, and Dr. Kadyani. And I invite our Shailendra panel, Dr. Arun Krishnan, Dr. Krishnananda C.R., and Dr. Usha. And I invite Panchakarma panel, Dr. Jinsi Joseph, Dr. Mahesh, and Dr. Ashwini Somasundaram. Next, I invite Samhita panel, Dr. Rama Devi, and Dr. Kavita Sajish. And now I invite our Dasa Barshija panel, Dr. Remyaji and Dr. Sindhu Lakshmi. Finally, I would like to invite Dr. Vivek, Dr. Sri Lakshmi, and Dr. Krishna Priya. Patience is not the ability to wait, but the ability to keep a good attitude while waiting. So always keeping this attitude, and I wish all the very best to all my participants. And I request all of you to kindly follow the rules. Each of you have maximum of 8 minutes for the presentation. So first, we have a paper presentation, and I would like to invite Dr. Amritha Surendran for the presentation. Dr. Amritha.
Hello. Am I audible?
Doctor, you are audible. Yes,
okay.
Doctor. Please share the screen.
Okay, thank you. Can you see my screen?
Yes, doctor. Screen is visible.
Yes, doctor.
Okay. Shall I start?
Yes, doctor.
Please, doctor.
Okay, thank you.
Please screen put.
Okay. Good evening to all. I am Dr. Amritha Surendran, final year PG scholar, Department of Rasashastra and Bhaishya Kalpana, GMC Bangalore. My topic is role of ABHRAKA BHASMA as Rasayana DRAVYA with a special reference to anti-aging properties. My contents are introduction, benefits of ABHRAKA BHASMA, Rasayana and its possible mode of actions, research work carried out on ABHRAKA BHASMA and formulation containing ABHRAKA BHASMA, discussion and conclusion. Introduction. Aging has been defined as a sum of physiological changes that progressively leads to the death of the individual. Jara or aging is not a disease, but a natural phenomenon like hunger, thirst, or sleep. The term Jara denotes four entities: Nityaga, which signifies continuation or consciousness; Dhari, which denotes the factors that prevent the body from aging; Jeevidam, which represents the act of keeping alive; and Anubandha, that denotes transmigration of the body. Rasayana therapy touted as the treatment in Jara, as it is strengthened the Dhadus, Indriyas, and improve general health. Bhasmas in general have Rasayana properties because of their ability to penetrate into the smallest units in the body and have therapeutic benefits when administered correctly. Bhasmas are a type of herbometallic Ayurvedic formulations that involves repeated incineration for various metals or their ores mixed with the decoction of various herbal products in Puda. These preparations are often considered nanomedicines as the components of final products generally possess the size in the nanometer range. Benefits of Abhraga Bhasma. The properties of Abhraga Bhasma includes Prajna Bodhi, Vrishyam, Ayusham Agryam, Balyam, which underlines its Rasayana effects from an Ayurvedic perspective. It is also said to be useful in Jara, Netra Roga, Grahani, Rektapita, etc. and it is generally reduce Vada and Kapha doshas. Rasayana and its possible mode of action. Shushra Samhita states that Rasayana Chikitsa includes the effects Vaistabana, which Dalhana Maharshi clarifies as maintaining the lifespan of 100 years, Ayushkara, which indicates increase the lifespan to beyond 100 years, Medagara to improve intellect and memory, Balagara to improve strength, Robagaharanam to improve immunity and to cure disease. So the mode of action of Rasayana drugs can be explained by following actions: antioxidant action, immunomodulatory action, anti-aging effect, nutritive function, and neuroprotective action. Research were carried out on Abhraga Bhasma and formulation containing Abhraga Bhasma. First, antioxidant action. Ram Bahadur Subedi conducted a study, modulation of oxidative stress by Abhraga Bhasma in Drosophila melanogaster. Abhraga Bhasma has been found to modulate the activity of superoxide dismutase and catalyze enzymes as well as the total reduced glutathione content. Larvae and adult feeding on diet supplement with Abhraga exhibits significantly lower levels of glutathione content. Conclusion was overall Abhraga Bhasma alters various parameters linked to antioxidant machinery in Drosophila melanogaster. The induced components may provide protection to the organism during stressful condition. Next, Gajendra Kumar conducted a study, neurobehavioral activity and oxidative stress in rat with Vasanta Kusamagar Rasa, which contain Abhraga Bhasma. Next is immunomodulatory action. Tamahangar Yogesh conducted a study, in vitro immunomodulatory activity of Shadabudi Abhraga Bhasma in nitroblue tetrasolium test. Shadabudi Abhraga Bhasma was subjected to in vitro screening to assess its immunomodulatory effects using the nitroblue tetrasolium assay. The results were self-conclusive and indicated that Shadabudi Abhraga Bhasma brings about stimulation of leukocytes in concentration-dependent manner. 5% and 10% solution of Shadabudi Abhraga Bhasma stimulated 93% and 93.5% leukocytes respectively, which is an indicator of highly significant phagocytic activity. Thus, the study revalidates the reference of Shadabudi Abhraga Bhasma as a rasayana and hence also establishing it is an immunomodulator. Next, hematinic action. Gigi Matthew conducted a study, evaluation of hematinic effect of Gudamarida Abhraga Bhasma, an experimental study. This study, conducted on Wister albino rats, showed significant increase in RBC and HB percentage in rats treated with the Gudamarida Abhraga Bhasma. Next is spermatogenic action. Bhatia BS conducted a study, Abhraga Bhasma treatment ameliorates proliferation of germinal epithelium after heat exposure in rats. The current experiment was carried out on 32 healthy adult male albino Wister rats divided into 4 groups. Shadabudi Abhraga Bhasma was used as the test drug. On sacrificing the animals after 30 days, it was observed that control animals had normal spermatogenesis and drug-induced animals showed hyperactive tubules. The present study reveals that the test drug can correct heat-induced male infertility and provide us with the possibility of treatment of human heat-induced oligozoospermia and azoospermia. Discussion and conclusion. When reviewing concept of classical rasayanas, focus is seen on the drug's effects in terms of prolonging age, improving strength, improving immunity, and improving mind function. This indicates an overall benefits in the various conditions associated with aging, such as memory loss, decreased immunity, and decreased strength. Classically, ABHRAKA was touted to be the best rasayana, especially with reference to Shatapudi and Sahasrapudi ABHRAKA. The pharmacological effect of ABHRAKA includes improving intellect and memory, spermatogenic effect, improving lifespan, and increase overall strength. Along with this, it improves acne, the digestive capacity of the body, indicating its effects in improving metabolism, with usually slows with age. On reviewing the above individual study carried out, we can effectively conclude that ABHRAKA exhibits a large number of properties that are seen in rasayana drug and can be used in various health issues that are associated with the geriatric changes. There are several other studies carried out with the effect of major properties of ABHRAKA as well as its efficacy in arthritic conditions. There is a scope of further studies to determine other mode of action of rasayana aushadhis and mode of action of ABHRAKA itself. Such research are required to validate Ayurvedic preparations and their therapeutic benefits. By this, I am concluding my topic. Thank you.
Thank you, Dr. Amritha. Next, I invite Dr. Sanket Ramesh Talokar for the paper presentation.
Hello, am I audible?
Yes, doctor.
Hello.
It's
My
visible,
name is
doctor.
Dr.
Please start.
My name is Dr. Sanket Ramesh Talokar from Poddar Ayurveda Mahavidyalaya, Mumbai. Today's my presentation topic is effect of VAMANA and DHUMAPANA in the management of venous, a single case study in the chronic sinusitis patient. Venous is a disease of Kapha dominance characterized by Shavathu, Navarasa, Nasa Srav. Prescribed woman therapy in it. This case study is about 21-year male patient, which is a chronic sinusitis patient of 2014, and he is taking treatment from Shalakya department of in our college, but he get relapse again and again after a particular period of time. So they referred to our OPD for woman therapy. Introduction. Venous is a disease of Vatkapaj Vyadhi, and it is a Kriya Sadhya Vyadhi described by the Charak Samhita. And there are Shodhan Chikitsa, Nidan Parivarjan, and Shaman Chikitsa, which are given in the our Samhitas. But Shaman Chikitsa here is given to the patient is not useful to the patient. So they prescribe for woman therapy to our department. इस केस में 21 साल का लड़का था जिसको नासा स्राव इन मॉर्निंग बहुत होता था और जो शवथु था वो 15 से 30 उसके वेग आते थे और रिकरेंसी उनका बहुत था, मॉर्निंग आवर्स में बहुत ज्यादा था जो कि प्रातः होता था, और शिरोगोरा था उनको मॉर्निंग में बहुत होता था जो सायंकाल के में भी भर जाता था। उन्होंने एलोपैथी की बहुत सारी ट्रीटमेंट ले चुके थे, उसके रिजल्ट उनको कुछ आए नहीं थे। उसका नाड़ी था ऑन एग्जामिनेशन डे था 80, मल सम्यक मुत सम्यक था, जीवा निराम थी, शब्द स्पर्श स्पष्टता तृष्णा सम्यक थी, अग्नि उनका अच्छा था, विषम था लेकिन भूख अच्छी खासी लगती थी, रक्तदाब भी नॉर्मल था। मटेरियल्स एंड मेथड, हमने उनको दीपन पाचन 5 दिन के लिए दिया था। अपा ने हमने आरोग्यवर्धिनी दी थी, समा ने हमने इंगवाष्टक चूर्ण दिया था घी के साथ, और रात्रि हमने गंधर्व हृदय के चूर्ण दिया था जो अनुलोमक काम करता था। स्नेहपान हमने पंचदिक घृत का दिया था, 5 दिन का दिया था, इंक्रीज डोज में दिया था। और 11th डे में जो एक दिन का गैप होता है वमन का, उसमें हमने तिल तेल से स्थानिक स्नेहन और पेटी स्वेद दिया था। और वमन का योग हमने दिया था मदन फल पिपली का चूर्ण 5 ग्राम, पिपली चूर्ण था 4 ग्राम, सेंधव 3 ग्राम, मधु 10 ग्राम के अराउंड था। और वमनात्मक द्रव्य हमने यूज किया था एसटी मधु। और संसर्जन एज उनको 6 बेग आए थे, इनके अनुसार हमने मध्यम जो शुद्धि क्रिया होता है उसके अनुसार 5 दिन का दिया था। असेसमेंट के क्राइटेरिया थे शवतु स्नीजिंग विथ व्हाट कॉल्ड, उनको जी थी 15 to 30 तक आती थी मॉर्निंग, नासा स्राव था और शिरोगौरता थी। उसके ऊपर वो माइल्ड, नो माइल्ड, मॉडरेट और सीवियर के में हमने डिवाइड कर लिया था 4 3 2 1 के हिसाब से। पूर्व कर्म में हमने दिया था दीपन पाचन जो 5 दिन में दिया था, और स्नेह स्वेदन और अभ्यंतर स्नेहपान दिया था। अभ्यंतर स्नेहपान के 5 दिन का उनको लक्षण सम्यक शुद्धि की सम्यक स्नेह लक्षण आ गए थे 30 ml, 70 ml, 110 ml, 130 ml, 170 ml। वातानुलोमन, मलानुलोमन व वर्चस्व स्निग्धता भी थी और स्नेह द्वेष भी पेशेंट को आ गया था। प्रधान कर्म में आफ्टर एडमिनिस्ट्रेशन ऑफ यष्टि मधुपान 6 वेगास आर कम टू द पेशेंट। और उसके साथ सम्यक शुद्धि की, हृदय शुद्धि, इंद्रिय शुद्धि और शिरो लाघवता, अंग लाघवता की भी लक्षण भी उन्हें मिल गए थे। उसके ऊपर हमने पश्चात कर्म में उनको धूमपान दिया था, जो कि उस दिन भी दिया था और उसके बाद भी 5 दिन के लिए उनको धूमपान के लिए कंटिन्यू रखा था। उस निर्दोष धूमवती का यूज किया था और संसर्जन क्रम दिया था 5 दिन। 5वें दिन शाम को उनको वन्य आहार देने को बोला था। और आफ्टर 7 days फॉलोअप हमने उनको सीतोपलादी चूर्ण पीडीएस दिया था और अद्राखंड भी बीडी दिया था जो कि 5 ग्राम अमाउंट में था। और आफ्टर उसके नेक्स्ट फॉलोअप में 15 डेज के फॉलोअप में हमने अगस्त्य हरित की अवलियों उनको प्रातः सायन एज अ रसायन दिया था। उसके बाद गैप्स नहीं हुआ था। डिस्कशन योग वाही, क्योंकि पहले हमने रूप से यह पान किया तो वही यह भी योगवाही कार्य करता है। और फिर और तिक्त गुण जो है कंठ विशोधन करता है और साइनस के ऊपर भी अच्छा तरीके से काम करता है। तो तीक्ष्ण सूक्ष्म व्यवहारिक गुण से अभ्यंतर स्मरण पहले से हुआ था तो दोष विलयन अच्छी तरीके से हो जाता है और सूक्ष्म व्यवहारिक गुण से वो स्टमक में आकर इजीली निकल के आने के अच्छी शुद्धि मिल जाती है। धूमपान के जो रहता है वो कटु रस, कटु तिक्त रस गुण भी कहा है, लघु गुण भी कहा है। वो क्लम, मेद, कफ, वसा इन सब का विशोषण भी करता है। इसलिए हमने इस पेशेंट को आफ्टर वमन के बाद भी 5 दिन धूमपान चालू रखा, जिससे कि शवतु और जो उनका नासा स्राव हुआ और जो पहले से रिकरेंस थी वो कम हो जाए, और वो हुई भी। रिजल्ट जो आए थे शवतु जो 15 to 30% जो डेली आता था मॉर्निंग में वो माइल्ड आता था और कभी कभार आता था, जो भी वो भी अगर टेम्परेचर से उनको कांटेक्ट आया तभी आता था। नासा स्राव जो 3 पर ग्रेडेशन में वो अभी बंद हो चुका था और शिरोगोरता भी ओकेजनली आती थी। सो कंक्लूजन, वुमन फॉलोड बाय धूमपान is effective in the management of PEENASA chronic sinusitis. Thank you.
Thank you, doctor. So next I invite Dr. Seema Ramrao Kadam. I invite Dr. Seema Ramrao.
Yes. Hello, myself Dr. Seema Ramrao Kadam. Am I audible?
Yes, doctor.
Can you see my screen?
It's not sharing, doctor.
Just a minute. Now, can you see my screen?
Yes, doctor, it's now visible.
Okay. Myself, Dr. Seema Ramrao Kadam, PG scholar of Ayurveda Sanhita and Siddhanta. Today's my topic for paper presentation is review of COVID-19 and its management according to Ayurveda. Firstly, I'll go with the introduction. COVID-19 is an infectious disease caused by virus SARS-CoV-19. As it is endemic, it thousands of patients have lost their lives and remained lifelong disabilities like respiratory distress, dyspnea on exertion, and mucormycosis, and such a lots of side effects. A novel coronavirus designated as a severe acute respiratory distress or SARS-CoV-19, CoV-2, was identified as the cause of cluster of pneumonia. The symptoms of this disease are mainly related to the respiratory system. 80% of the patients who became infected have a very little or no symptoms, and 15% shows some symptoms, while 5% shows severe symptoms with multi-organ involvement. Although much information is available on the manifestation of the disease, satisfactory treatment is still not available by allopathy. Corona will go with the little introduction by allopathy first. So COVID-19 are a large family viruses that causes illness ranging from common cold to severe diseases. Incubation period is said to be 2 to 14 days. Again, it depends on person's immunity, and onset of symptom is different, like 5 to 7 days. Common symptoms were cough, dyspnea, fever, myalgia, headache, sore throat, loss of taste and smell, diarrhea, abdominal pain. And signs will decrease oxygen saturation level and tachypnea. COVID-19 patient currently diagnosed as follows for the easement of treatment. Like first one is asymptomatic patient, second one is patient with mild to moderate symptoms, and third one is patient with severe signs and symptoms and with comorbidities. Diagnostic test by allopathy were hemogram, serum ferritin, CRP, C-reactive protein, D-dimer, interleukin 6, and HRCT of test. Allopathic physicians used to advise supplying oxygen support, antibiotics and antivirals, vitamins, and other elements. Need of what is the need of Ayurveda for COVID-19 is like the contribution of Ayurveda is useful for prevention of this disease as well as for the treatment of patient. Ayurveda proved itself very effective in prevention and treatment of COVID-19 patient without leaving patient with any harmful side effects for lifelong. As Acharya Charaka's Duer model identifies factors affecting and proposes management guidelines for different stages and various subsets of patients. Ayurveda also identifies important preventive principles along with the medications with aim to restore balance between man, nature, and its health. COVID-19 according to Ayurveda, we can call it as a Janapada Dhunsa Vyadhi as mentioned by Charak Samhita in Vimansthana, Maraka by Sushruta Samhita. As Janapada Dhunsa literally means destruction or annihilation of communities or settlements. Epidemics and outbreaks of highly communicable disease have blighted mankind since time immemorial. COVID-19 is also similar to above, as entire community is affected in this endemic. Upsargik roga can also be considered, can be correlated with COVID-19. According to Ayurveda signs and symptoms were Jwara, Pratishaya, Kasa, Dyspnea, that is Shwasakashtata, and Angamurda. Dosha Dushti is said to be 3 doshas. Again, it depends. Sometimes it's a Dvandva Jala, depends on Prakriti of patient, Desha, Kala. Srotas Dushti involved is like Rasava, Srotas Dushti, Pranavaha, and Annavaha. Other factors that could be taken account like Ama Utpatti, Sannipat Avastha, and Dhatupak Avastha. Management, for easement of management, we divided patient into 2 as Ayurveda's Prayojana is Swastasya Swastarakshanam Aturasya Vikara Prashamanam cha. The first is preventive treatment. It will include asymptomatic patient or healthy people and people those who got exposed to COVID-19. And second one is disease treatment, that people with the COVID-19 symptoms. Preventive treatment according to Ayurveda includes Rasayana Dravyas that are known for their immunomodulation and rejuvenation properties, which played an important role in the prevention and management of COVID-19. Numerous Rasayan drugs demonstrated the immunomodulatory effect in vitro and clinical studies. For example, Ashwagandha, Guruchi, Chavanprash, Brahma Rasayana, Amrit Bhallataki, Surana Prashan, Sanjivani Vati, etc. Ashwagandha provides antiviral immunity by increasing interferon gamma and anti-inflammatory activities by decreasing the quantity of interleukin 1 and interleukin 6, which are the main factors related to COVID-19. Ashwagandha helps in enhancement of immunogenicity and constructive effect on symptoms and conjugation with anti-tuberculosis drug used in directly observed treatment of short course. Kalpa were like Ashwagandha Churna, Ashwagandha Bhanavati. Next one is a Guduchi Rasayana, as it's called Amritha. It has its immunomodulatory activity and enhances innate immunity against COVID-19 infections. Enosporin, diterpenoid, and has a very effective antiviral properties, especially for the treatment of retroviruses and other viral diseases. Kalpa is again used Sanshamani Vati or Guduchi Churna. Chavanprasha, particularly it alleviates kapha and dyspnea. It said that kasa shwasa harascheva visheshena upadishyate shrina kshatanam buddhanam balanam chamdavarganam. It alleviates hoarseness of voice, chest disease, heart diseases, which are the main symptoms in COVID-19 disease. Next, we'll come to the disease treatment. We'll divide it again in two parts. That is, patient with mild COVID symptoms and patient with severe COVID symptoms. This category includes people found positive to SARS-CoV-19 and are having mild URTI, upper respiratory tract infection symptoms. It will be needed isolation first and strict monitoring of their sign and symptoms with adequate therapy to arrest the sign and symptoms and balancing the vitiated doshas to control the disease progression further. Kalpas used are Lakshmi Vilas Rasa, Pipali Rasayan, Sanjivani Vati, Vyakri Harithi, Kantakari Avleha, Dashmul Hwat, Sitopaladi Churna, Talisadi Churna, and Yashtimadu. We'll take in detail of Pipali Rasayana. It's said that Panchasto Saptadashava Pipali Madhu Sarpesha. Either Pipali in number of 5, 7, 8, or 10 should be taken with honey and ghee, which are effective in Kasa Shwas, Kasa Kshaya, Shosha Swasa, Hikka and Galamayan. Again, it is said that if there is a Kapha Dosha Dikya, Pipali, Bhratu Bharjit Pipali should be taken at early morning. If Madhyam Dosha, it should be taken before food. And if Alpa Dosha Buddhi, it should be taken after food with a ghee and honey as a anupana. It should not be given in Pittash Prakriti, as it is the Pitta Vardhapraga. Again, Sitopaladi Churna, Sitopala, Tubakshari, Pipali, Bahula Tvacham. Mixture of all above drugs, and anupana is honey and ghee. Its use is mainly in Shwasa Kasa and dyspnea, excess of kapha, and anorexia and Agni-mandya. As anorexia is a prime symptom and first one symptom seen in a COVID patient, Sitopaladi Churna had shown its miraculous effects in such patients, and even it ensured them like they can be treated with a little medical or without any side effects. Next one is in disease treatment will take patients of moderate to severe COVID-19 patients. Population with moderate to severe symptoms already present, and the patients also belongs to the high risk group, that is with comorbidities like hypertension, diabetes mellitus, and need a tertiary care. So Ayurveda medicines co-prescribed with modern medicines to buy some more time, as it was a crucial period and not much studies were available. So Ayurveda medicines were given with some allopathy medicines. In this case, Rasaushadhis should be used, as it has been in case of Rasaushadhis, it said that Alpa Matra Upayogitva, Shipra Arogyadayitva, as it works miraculously in small doses, easy to administrate, helps in acute condition, and it has its extensive therapeutic uses. And further, one more benefit of Rasa Aushadhi use is like it doesn't need any prior examination or any test. As Acharya has already said, na doshanam na roginam samyak eva parikshanam na deshasya kalasya kriyam rasa chikitsate. When you are treating patient with Rasa Aushadhis, you don't need to examine everything in detail like we used to do with other patients. Like no need to samyak pariksha are not needed to be done in detail. You can use it as in an acute condition, which was a correct condition of COVID-19 disease. Rasa Aushadhi should be used in such conditions are Abhrak Bhasma, Vanga Bhasma, Kafakutar Rasa, श्वासकुठार रस, श्वासकास चिंतामणी रस, वसंतकल्प and हेमगर्भ पोट्टली रस. श्वासकास चिंतामणी रस, it contains पारद गंधक, लोह भस्म, अभ्रक भस्म, स्वर्णमाक्षिक and मौक्तिक भस्म and swar. According to Bhaishajya Ratnavali, it is used specifically in Shwasa and Kasa Roga, asthma, interstitial lung diseases, and such other respiratory diseases, which is the case of COVID-19 disease. It's a study verified that Shwasakasa Chintamani has an anti-inflammatory, analgesic, anti-hypoxic results and useful alternative available to non-steroidal anti-inflammatory drugs used for COVID-19. Hemagarbha Pottili Rasa, which is again a kalpa of Paragandhaka, Swarnamakshi. The method of its administration it is given in a sublingual 0.65 mg to 125 mg with Ardrak Swarasa. It helps in its quick absorption directly from tongue to the blood. As the tongue has a rich blood supply, it also escapes the first pass metabolism which occurs in medicine through oral route. So a little quantity is proved to be effective in controlling emergency stages of COVID-19 by Hemagarbha Pottali Rasa. They are specifically preferable in disease like Shaya, Kasa, Shwasa, miraculous medicine in respiratory disease, and myself acknowledged the use of Hemagarbha Pottali in our institute of ICU patients of COVID-19, and it shows its tremendous effect. Within 3 to 4 days, we have seen clear chest X-ray of patients with using of Hemagarbha Pottali Rasa and Shwasakasa Chintamani Rasa. Next one is the Ahar Yojana. It's as it is a Vata Kapha and Jwara Pradhanta in COVID-19. It's a Sedul Langhanam Svedanam Kalo Yavago Suttako Rasaha. Langhana, that is not actual fasting, but you should go with a Yavagu Pan, Manda Peya, and Tiktarasa drugs should be used. Langhana reduces and aggravated doshas, and it stimulates Agni, and person's appetite is restored due to Langhana. Lagu and Ushna diet is preferred in COVID-19 patients. Ushna Jalapana. Again, in Janopada Dhamsaniya Adhyay, Acharya Charaka mentioned the importance of Ushna Jalapana in Janopada Dhamsa Jani. It is said that Pachanartham cho Paniyam Ushnam Tasmat Ved Joritebhyam Prayachanti Bishajo Bhunistam Taddi Tesham Pitam Vatanu Lomayati Agnicham Udiriyati Shipram Jaragachati Shleshmanam Parishoshayati. It's again a case of a COVID-19. It helps to digest and it dries up kapha. It relieves the thirst even in a small quantities. Discussion part, it is proved that Ayurveda is not only effective in prevention of COVID-19 disease, but also can be effective in moderate to severe cases. Proper diagnosis with medicine and dietary management provides relief from COVID-19 without any adverse effect. Ayurveda regimen can be effectively used in severe cases of COVID-19 cases if used accurately. Our conclusion is future studies and trials of Ayurveda are needed to prevent such diseases like COVID-19 and build human immunity for such epidemics, that if it is used early, could avoid the characteristic complications of COVID-19, should include Ayurveda prevention treatment to make human body resistant for such endemic situations. As myself work as a medical officer with ICU patients of COVID-19, and I also work as a international trial of Ayurveda drug for COVID, I can certainly say Ayurveda not only can cure a mild cases, it can be very effective in severe cases. Sometimes we need a little support of allopathy, and sometimes we can do it on all alone. So it is always said that Ayurvedo Amrutana. So it's like I'll conclude my session by saying that. So thank you, everybody.
Thank you, Doctor. Next, I would like to invite Dr. Akshata Vijay for the paper presentation.
Am I audible?
Yes, Doctor.
Good evening. I'm Akshata Vijay Mhetre. My topic is a comparative clinical study of a SHWETA, ARKA, MOOLA, LEPA and MUPIROCIN ointment as a ROPAN in the management of AGANTUJA. Introduction. In Ayurveda literature, Sushruta, father of Indian surgery, has documented different types of vrana, mainly Nijavrana and Agantuja vrana. Do vrano bhavati sharira aguntascha. Nijavrana includes all those causes where the systemic involvement of the body found, whereas in Agantuja variety includes vrana caused by the external factors such as trauma, insect bite, chemical exposure. The destruction, rupture, discontinuity of body tissue, part of a body is called as vrana. A wound is a simple when skin is involved. It is complex when involves nerves, vessels, tendons. Wound healing is a complex phenomena involve different phases, includes inflammation, granulation, fibrogenesis, wound contraction, and epithelialization. Proper wound care prevent infection and other complication and also helps speed up the healing process with less scarring. In Ayurvedic science, various modalities of treatment expand from management of Agantuja. Alepa is said to be superior by Acharya Sushruta and Acharya Charak. There are mainly 16 types of wound because of Dushta Vrana. There are 15 types of Vrana and many types of Acharya also add Shuddha Vrana. So totally there are 16 types of Vrana. Tough, there is a Agantuja Vrana. Wound healing process is delayed due to the bacterial growth, pressure, trauma, and edema. So there is a need to find drug which heals wound as early as possible. If it is not treated properly, it will get infected, such as bacteria grow within the damaged skin of the wound, resulting in increasing pain, swelling, and redness. In more severe infection, may causes chills, fever, pus formation, and foul odor. Need for study. All wounds are similar, whether made by the surgeon knife or by the external factor. They differ in degree, but not in nature. The tendency to regard wound is civilian practice as different from the easier to manage them than those of war has led therefore. May be taken as applying to both war and peace. Wound healing is one of the most major concern among the healthcare. Restoration of damaged tissue. It is an important process which play a vital role in survival of life. Vaishyaja Ratnavali says Shweta Moola Lep heals any types of wound which is most easily available, cheaper than any other modern drug, or without any side effect. So there is need to research for safer method, less expensive and better efficacy. A research question. Aim and objective to study the efficacy of a Shweta Moola Lep in Agantuja Vranaropan. Plan for work. A drug formulation. Shweta Moola Churna is prepared and it is mixed with the required amount of a Nimbu Swaras in iron vessel. When proper consistency achieved, lep is ready to apply on clean wound. Before applying lep, wound should be cleaned and with normal saline, then lep should be applied. MUPIROCIN ointment. It is an antibiotic active against gram-positive bacteria. It inhibits bacterial protein synthesis by blocking production of a tRNA. It is primarily bacteriostatic. It is highly concentrated. It is bactericidal 2% ointment used for wound healing. Treatment detail. Subject for inclusive criteria. Patient of age group between 20 to 60. Patient having Agantuja Vrana restricted to localized area between 2 to 10 centimeter on skin. Patient will be selected irrespective of sex, religion, economical status, and education. Vrana which is not secondary to systemic disease. Exclusive criteria. Age below 20 years and above 60 years from the study. Ulcer secondary to any malignancy, immunocompromised patient, osteomyelitis, gangrenous wound, history of any adverse reaction, burn wound. Withdrawal criteria, any emergency health condition, patient who want to withdraw from study. If patient will show any type of adverse effect. The discussion. As per Ayurveda, in case of Agantuja Vrana, three doshas were not vitiated to initial stage. Later it vitiated and symptoms are manifested. The parameters of pain, swelling, discharge, along with the condition of floor, margin, granulation, tissue and size wound recorded. On first consultation, patient came with unhealthy non-healing wound. On 7th day, wound was observed into smaller size and good epithelialization. On 21st day, wound was completely healed. Result, there is a significant effect of SHWETA ARKA MOOLA in management of Agantuja Vrana Ropana. Thank you.
Thank you, doctor. So next we have a poster presentation, and I invite Dr. Sridevi K for the presentation.
Okay, ma'am. Am I audible?
Yes, doctor.
Audible, doctor.
Is my screen visible, doctor?
No, doctor, it's not visible.
Sorry, doctor. I will.
Dr. Sridevi.
Hello.
Dr. Sridevi, please be there. You can present next.
Okay.
So
Okay, ma'am.
next we have a paper presentation, and I invite Dr. Deepanshu for the presentation. I invite Dr. Deepanshu.
Yes, ma'am, I'm audible.
Yes, doctor.
Yes. Can you see my screen, ma'am?
No, it's
Yes,
now
doctor.
sharing, doctor.
Screen is shared, ma'am.
Yes,
Yes,
screen
it's
is
visible now.
visible, doctor.
Okay, ma'am. Namaste, ma'am. Myself, Dr. Deepanshu, second year scholar from the Department of Shalakyatantra, Alwas Ayurveda College, giving a presentation on the importance of Ashtvi Shastra Karma with respect to the Netra Shastra Chikitsa. These are the contents of my presentation. Coming to the introduction, Ayurveda Shalya Chikitsa offer great contribution in the field of surgical problems. Ashwi Shastra Karma is one of the great approach of the Shalya Tantra, which involves 8 surgical procedures based on the different principles. These surgical approaches can be employed for the various intervention depending upon the types of disease in which is to be cured. Ashwi Shastra Karma involves the procedures such as Chedana, Bhedana, Lekana, Vedana, Vistravana, Eshana, Aharana, Sivana. These all techniques offer relief in the various surgical activities like Shmari, Jalodra, Visarpa, Pakva Vriddharthi, and Sadhyavan, etc. Coming to the Ashwi Shastra Karma, these are the Chedana, Bhedana, Lekana. According to the Chedana is incision, Bhedana is incision, Lekana is scraping, Eshana is probing, Aharana is extraction, Vedana is puncturing, and Visravana is draining, and Shivana is suturing. Dalhana opines that among of the 8 surgical procedures, Chedana, Bhedana, Lekana, and Vedana are mainly employed in the eye disease. And Chedana, that is excision of the part of the body. Indication are given like the Bhagandhara, Kafaja Granthi, Varna, Varatama, Arsha, like this. Coming to the Bhedana, Bhedana involves incision procedure to open a cavity for the drainage of the tissue, debris, and waste discharge. Indication are the all type of disease except the Sanipada Vriddhi, Vataja Vittaja, and Kafaja Granthi. Shofa, Alaji, Shudra, and Ashmari. Coming to the Lekhana, this technique involves scraping of waste, debris, dead material from the affected parts. Indication is Vataja, Pitaja, Kapha, Sanipadaja, Rohini, Kilasa, Medas, Granthi, etc. Coming to the Vedana, it involves functioning of the affected parts. Indication are the Sira Vedana, Mutra Vedana, the Kodara. H9 in snooping of waste, discharge, debris, foreign material, etc. Indication is Nadi Varna, Shahalya Varna, and Unmargi Varna. Coming to the Arna, Arna involves the extraction of the waste of the disease part. Indication is Dantamula, Karna Mula, Ashmari, Shalya. Vistravana. Vistravana is a purpose for the blood letting purpose for the drainage of the pus. Indication is 5 types of Virdadi, Ekadasha Shofa, Shalipada, Visarva, Sanipada, all kind of Abruda, all kind of Visarpa, etc. Coming to the Sevana, it is a parasurgical approach involves use of the suture, needle, and the thread as the post-operative management. Indication is diseases which are due to vitiation of medas, cut wounds, etc. Coming to the Netra Shastra Karmas, Ayurveda science of life is the oldest treasure of the medical science, where many diseases involved has been described in the detailed prognosis, internal medication, and surgical intervention, which is gradually achieved by the Western medication, and following the same with the aid of the advanced technology. Shalakya Tantra, one of the specialist branch of the Ayurveda, deals with the disease of eyes, nose, ear, throat, and head. Surgery is an integral part of the Ayurvedic treatment, especially in the Netra Chikitsa, where surgical procedures like Lekhana, Chedana, Bhedana, Vedana, Shar, Agni Karma has been clearly indicated in the Netra Roga. Shushruta, being the pioneer of the Indian medical surgery, has mentioned that out of 76 diseases, 40 diseases can be cured by surgical interventions. Diseases mentioned by the Shushruta according to the parasurgical procedures, according to the surgical techniques, are the 11 diseases are Chedya, 9 diseases are the Lekhya, 5 diseases Bhedya, 15 diseases are Vedya. These are the 40 diseases that are mentioned by the Acharya Shushruta, treated by the surgical techniques. Chedya Netragata Rogas are the Arshavatam, Shushka Arsha, Vritam Abruda, Shira Pedaka, Shira Jala, Parvarni, and Arma. Coming to the Arshavratama, it is a Vatgata Roga, occur in the eyelid. In this condition, many small and rough boils are formed on the eyelids. These boils are associated with the mild pain. If we correlate with the modern, it can be closely correlated with the papillary form of the trachoma formed in the eyelids. Coming to the Shushkasha, it is one of the Vartamagata Rogas occur in the eyelid. It is a condition in which the hemorrhoid like masses are the appears in the dry are formed in the anterior of the eyelids. Modern correlation can be done with the chronic form of the papillary trachoma. Vratama abrud is one of the diseases of the eyelids. In this condition, an irregular cyst is formed on the interior of the eyelid. It is devoid of pain but appears red. The cyst hang free from the eyelid margin. Modern correlation can be done with the tumors of the eyelid. Serapedica. Serapedica is one of the diseases of the sclera. It is a condition where colored boils are formed on the sclera surrounded by the blood vessels and can be correlated with the deep scleritis. Sirajala, it is one of the diseases of the sclera of the eye. It is a condition of the eye where the red color network of the blood vessels are formed over the sclera of the eye. This condition is caused by the vitiation of blood, and modern correlation can be included the bulbar conjunctiva. Pravarni is a thin circular red colored swelling occur in the sclera corneal junction, that is Krishna Shuklagata Sandhi. Modern correlation can be done with the marginal ulcer of the cornea. Now coming to the 5 types of armas, there are 5 types of armas. It is a disease of Shuklavartama. 5 types of armas have been described in the Ayurvedic text. The gradually spreading extramembranous Shuklagata mandal is known as the arma. Coming to the Bhedya Vyadhis. Bhedya Vyadhis are Anjanamika, Langana, Bisuvartama, Krimigranthi, and Upnaha. Anjanamika, it is a Vartamagata Rakta Bhedya Vyadhi. A small copper colored follicles originate in the eyelids. The patient experiences Daha, Toda, and Manjaruja. Modern correlation, it can be correlated with the external hordeolum of the stye. Langana, eye disorder of the eyelid caused by the vitiated kapha, in which a cyst-like growth appearance on the eyelid, which are hard to touch and do not separate, are also devoid of pain, are called Langana. Modern correlation, Langana can be correlated with the chalazion or the mebibian cysts. Bisuvartam, it is a Vartamgata Roga. It is named on the basis of the resemblance with the perforated stalk of the lotus. In this condition, a swelling occur in the eyelid and many small perforation around the swelling, giving it appearance of the star-like lotus flower present deep in the water. Modern correlation can be done with the ulcerative conjunctivitis. Coming to Kremigranthi are the small cysts caused by the worm in the junction of eyelids and eyelashes, and also the meeting place of the eyelid and sclera. Modern correlation can be done with the blepharitis. Coming to the Upna, Kremigranthi can be compared to the blepharitis. Upna is a disease of Netraga Santhi characterized by the non-nodular swelling, non-suppurative, painless, associated with the itching. This condition can be correlated with the lacrimal cyst. Coming to the Lekhya Vyadhi of Netragat Rogas. Lekhya Vyadhi of Netragat Roga, according to Shushruta, are Utsangini, Bahalavartama, Kradam Vartama, Shavartama, Badavartama, Klishtavartama, Pothki, Kumbhika, and Vartama Chakra. Coming to Utsangini, Utsangini is one of the disorder of the eyelid. Utsangini mean core, since the disease appears to be a core of the eyelid. To be precise, is called Utsangini. It is a disorder of eye in which a swelling occur in the core of the eyelid. Swelling is a big in size and can be seen from the outside, but it opens inwards. It is hard in texture, and on the touch, it is associated with the mild pain. Correlation can be done with the chalazion. Bahalavartam, it is one of the diseases of the eyelids. In this condition, the lid is covered from all the sides by many balls of swelling, which are alike each other in the appearance and which have a small color that of the surrounding skin. Bahala means many or multiple. Therefore, this condition, there are many type of lumps on the eyelids and thus called as Bahalavartam. Modern correlation can be done with the multiple chalazion. Kadam is one of the eye diseases of the eyelid. Kadam means the dirty or the mud. Vartam means the eyelids. This condition is the eyelid, which means the eyelid look like muddy or dirty in appearance. Modern correlation can be closely correlated with the non-ulcerative blepharitis, as mentioned in the modern textbooks. Shavavartama is a Netravartam Roga, that is one of the diseases of eyelids. Shav means the dark brown, Vartama means the eyelid. Thus, it is a condition of eyelid where the eyelid look dark brown and in the appearance. It is a condition associated with the swelling, pain, burning sensation, itching, and dampness. Modern correlation can be done correlated with ulcerative blepharitis. Sanskrit word of abhadva means the obstruction in the closing. It means the disease of eyelid, the swelling prevent in the eyelids lid in a proper closing. Modern correlation can be done with the angioneurotic edema of any allergic condition of the edema of the eyelid that prevent proper closure of the eyelid. Coming to the Klishtavartama, the word Klishtavartama indicates the painful eyelid. This condition can be defined as a disease of eyelid with a sudden reddish discoloration. Mild pain will be present in this condition. Modern correlation can be done with allergic conjunctivitis. Coming to the Pothki, is a disease of eyelid. It is a condition boil appears like the mustard seed in the shape of the eyelid. These are the associated with the eye discharge, itching, and in the eye, heaviness in the eye, pain in the eyelid. This condition is called as modern correlation can be done with the glandular conjunctivitis. Coming to Kumbhika, Kumbhika is one of the diseases of the eyelids. Kumbhika means the seed of the fruit resembling to the pomegranate fruit, since the swelling resembles the seed of a pomegranate, known as the Kumbhika. Modern correlation can be correlated with the internal hordeolum or the internal style. Coming to the Vartam Chakra, a large nodule surrounded by a number of minute thick packed granules is known as the Vartam Chakra. Modern correlation can be done with the glandular form of trachoma. Coming to the Vyadhan Vyadhi of Netragat Roga is Siropatha, Siraharsha, Anyanvata, Vata Pitta Kapha Rakta Abhishanda, Vata Pitta Kapha Rakta Abhimantha, Vata Viparyay, Puyalasaha, Shashopakshipaka, and Ashopakshipaka. Sirotpatha. The disease of Sirotpatha is a symbol of rather than the disease. The word Uttapatha means the Udarva and the complication of increased dosha in the body. Modern correlation can be done with the inflammatory condition of conjunctiva and sclera. Siraharsha is the increase of the Sirotpatha due to the neglected lid of the Shiraharsha, in which there will be difficulty in the visual perception. The modern correlation can be done with the hyperemia of the eye, and the advanced stage can be correlated with the active stage of episcleritis and iridocyclitis. Siroshopakshipaka, this condition will separate the producing itching, excessive discharge in the tears, turning the eye into the brick red like ribbed fruit called the Shashopakshipaka. Modern correlation can be done with the cellulitis of the orbit or uveitis. Ashopakshipaka, presence or the absence of edema of a Shashop. The difference between the Shashop and Ashopakshipaka, as the name indicates, there is a mild swelling as compared to the Shashopakshipaka. Anyonavata, in the condition, the patient feel acute pain in the eyelid and eye. There are no redness, inflammatory, and tears. Modern correlation can be done with the with the pain in the eye, and the pain is mainly confined to the blood vessels and the nerve of the eye. Vataja Abhishanda is a condition of the obstruction and the swelling of the nasal cavities and the pain in the temporal region. The pain of the pain will be piercing, pricking, and blowing type of pain. Modern collation can be done with the subacute allergic conjunctivitis. Vataja Abhishanda, it is a condition in which the external surface of the eyelid is grayish discolored and a sensation of burnt wound will be felt on the eye. Vataja Abhishanda can be correlated with the acute conjunctivitis. Raktaja Abhishanda, clinical feature of the Raktaja Abhishanda are similar to the Pittaja Abhishanda. Modern correlation can be done with the disease of uveal tract. And then coming to the Vata Dimanta. Vata Dimanta is a condition of the pain. Patient feel the as if eye is being extracted out of the socket. It can be correlated with the acute congestive glaucoma, iridocysttic acute orbital cellulitis. Pitta Dimanta, the feature of Pitta Dimanta are full of the red streak of the eye discharge. Feel like if as if fire is burnt inside the eye and feel like the shining piece of the liver. Can be correlated with the secondary glaucoma, iridocyclitis, and orbital cellulitis. Kapha Dimanta, there is a swelling but not the excessive congested. There will be concave type of swelling and the concave type of in the Krishna Mandala. Modern correlation can be done with the complication of cupping of the optic disc. Rakta the feature of Rakta in the eyebrow is glowing red blood are all around. I feel like visual darkness is there and appearance is there, and modern correction can be done with the glaucoma based on the clinical features. Vyalasa is a disease of Netragata Sandhi characterized by the separated swelling in the sandhis, heavily discharged, having foul smelling pus. Modern correction can be done with the dacrositis. Vata Visarpa Viparya is a disease producing the alternative attack on the pain in and eyebrow. The pain is very severe but subside and get shifted to the other eye quickly. This disease is also called as a Vata Viparya. Motor correction can be done with the trigeminal neuralgia, ocular pain due to the sinusitis, and chronic glaucoma. Thank you all.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Sridevi, and before let's start, let me remind you, dear participants,
Hello.
you have maximum 8 minutes for the presentation. Kindly do follow that. Now I invite Dr. Sridevi for the poster presentation.
Thank you, ma'am. Ma'am, can I start?
Please, doctor.
Am I audible, ma'am?
Yes, doctor.
Okay. Good evening, all. Today I am presenting a poster. I am Sridevi KM, final year PG scholar, Department of Prasudhitandra and Sri Roga from Amritha School of Ayurveda. I am presenting a poster based on hair loss in females. Female pattern of hair loss is the most common hair loss disorder in women. Initial symptoms may develop during the teenage years, and it may lead to progressive hair loss with a characteristic pattern distribution. The affected women may experience psychological distress and impaired social functioning. Early diagnosis and initiation of treatment are desirable because treatment are more effective to avoid the progression of hair loss than stimulating regrowth. Then we can go to the common causes of hair loss. It may be due to the hairstyle, vitamin deficiency, dieting, restrictive diets, over-processed scalp hair, some medications, and due to some side effects of some therapies like that. Mainly hair grows in 3 different cycles: anagen phase, catagen phase, and telogen phase. The anagen phase refers to the growth phase. It lasts for 2 to 8 years. It refers to the 85 to 90% of hair growth. A catagen or transition phase corresponds to 2 to 3 weeks. In this phase, hair follicles shrink. And next, the telogen phase. In this, it lasts for 2 to 4 months. In this phase, the hair rests and gradually the hair falls down. Hair falls and grow in a balance. When this balance interrupts, hair loss happens. Now we can discuss the types of hair loss. Mainly 3 types of hair loss are the anagen effluvivum, telogen effluvivum, and female pattern of hair loss or androgenic alopecia. Anagen effluvivum means it is mainly due to the poison medications. That is the poison contents in some medications leads to the growing of hair follicles. That means the medications we are practicing in the daily life may damage the growing hair follicles and leads to the hair loss gradually. Telogen effluvium is mainly caused by the increased number of hair follicles reaching the telogen phase, that is the stage where hair falls out. Next is the female pattern of hair loss or androgen alopecia. It is the most significant cause of hair loss in women. It affects about one third of the susceptible women. Next, we can go to a classification scale that is Ludic classification scale. That is, it measures the hair loss in women. In my poster, we can see three rows. In the first row, it refers to the type 1, and in the second row, type 2, and in third row, it type 3. In the first row, it is minimal thinning that can be managed with the hairstyling techniques. That is, it cannot be identified to much extent. In the type 2 type 2, that is, we can see in the second row, it is characterized by decreased volume and noticeable widening of the midline part. It can be seen to much more extent than the type 1. In the type 3 pattern, it describes diffuse thinning with can be seen through the appearance on the top of the cap. It can be easily identified, and it leads to a progressive and noticeable margin of hair loss. Next, we can go to the treatment, major treatment patterns in the hair loss. Mainly topical applications, systemic, and hair transplantation techniques are adopted. Mainly, a lot of topical applications are practiced. It is like prostaglandin analog treatments, melatonin topical applications, and microneedling applications, and the combinations therapies of mixed treatments can be adopted. Systematic treatment modalities include we can treat the cause the underlying cause that leads to the hair loss, like PCOD, like systemic diseases that may lead to the hair loss. Then hair transplantation. Finally, the hair transplantation techniques. It adopts if other techniques did not result in the cure of symptoms. Now, I conclude my presentation that early diagnosis and initiation of treatment are effective to avoid the progression of hair loss than stimulating the regrowth. Diagnosis can be confirmed by the review of patient's medical history and physical examination alone. By merely physical examination itself, we can confirm the hair loss in females. The management imposes some difficulties to our daily physician's clinical practice, but improved diagnostic techniques day by day needed to develop new and more effective therapies need to be adopted to prevent and reverse the disease course. Thank you.
Thank you, doctor. So next I invite Dr. Deepnayan Davis Rao Shinde,
Yes.
paper presentation.
Yes, ma'am. Hello. Audible?
Yes, doctor.
Yes, ma'am. Hello.
Doctor, you are audible. Please share the
Yes,
screen.
ma'am. Yes. Ma'am. Hello.
Hello, doctor.
How problem with the doctor?
Okay.
Next.
Doctor, You are not able to share the screen now?
Yes, second.
So, doctor,
1 minute,
you
doctor.
can.
1 minute, doctor. I will share for you, doctor. Okay, Dr. Deepnain, we will call you on after next.
Okay.
Doctor, please be there. We will call you next. So next I invite Dr. Nimisha Upadhyay. I invite Dr. Nimisha.
Yes, ma'am.
Doctor, please share the screen.
Hello.
Doctor, you are audible.
Yes,
Please
ma'am.
share the screen.
Yes, ma'am. 1 minute, I'm sure. Hello.
Hello, doctor.
Am I audible, sir?
Audible,
Yes,
doctor.
doctor, you are
Please share.
audible. Please share the screen.
Good evening, everyone. This is Dr. Nimisha Upadhyay from
Dr. Nimisha.
Department of Dravya Guna. Yes,
Hello,
ma'am.
Dr. Nimisha. Your screen is not visible.
1 minute. Screen is not visible.
Doctor, is there any problem?
Now
Yeah, it's
is it visible?
now. Yes, doctor. Doctor, please start.
My topic is Chitraka Granthi Adi Kashaya. And I'm from the Department of Dravya Guna and Vigyana from Alva Sarveda Medical College. The content of the presentations are introduction, reference of Chitraka Granthi Adi Kashaya, ingredients and properties of Chitraka Granthi Adi Kashaya, dosage and administration, indications, analysis of yoga based on indications, research articles, conclusion, and availability. Moving on to the introduction, Chitraka Granthadi Kashaya is an Ayurvedic medicinal preparation in the form of decoction. It is a combination of drugs having hot potency and deep reaching action in the body, used in pain, distension of the abdomen, constipation, dysmenorrhea. It is explained by Acharya Vagbata in Chikitsa Sthana Gulma Chikitsa Adhyaya. It mainly contains Chitraka, Pippali, Erenda, Shunti in equal part. The reference can be found in the Ashtanga Hridaya Chikitsa Sthana, 14th chapter, 48 shloka. And the reference is also found in the Sahasra Yogam. The ingredients are Chitraka, Granthika. Granthika is also known as the Pippali. MOOLA is also called as Granthika. Erenda and Shunti. Coming to the Chitraka, the botanical name is Plumbago xylanica. Belongs to family Plumbaginaceae, and it can be found in the Gana according to Charaka in Dipadiya Varga, Triptigna Varga, Shula Prashamana Varga, etc. And by Shushruta, it can be found in Pipalyadi Gana, Mustadi Gana, Amlakyadi Gana, etc. And the vernacular names are in Hindi, it is called Chitta. Panchaka of the drug is Katu Rasa, Tikshna Guna, Ushna Virya, Katu Vipaka, and Vata Kapha Shamaka. And the main karmas of the drug are Deepana, Pachana, Kushtagna, Arshogna, Shotahara, Krimigna, Khasahara, Grahi, Rochaka, and Kandugna. Moving on to the Amayaka Prayoga of the Chitraka. It is used in the arches as the paste prepared from the Chitraka Moola Twak applied to the mud vessel, and Dadi or Takra is prepared in that vessel, and it helps in relieving the arches, and the reference I have given there. The next is Shwitra, Chitraka plus Pipali added with Maricha and Shunti mixed with Gomutra, honey and ghee, kept for 15 days, and it's given orally. The next is Kushtha, Chitraka Churna plus Gomutra, which is useful in the Kushtha. The fourth disease is Atisara. Chitraka plus Takra is useful in the Atisara. The next drug is Granthika, that is Pipali Moola. The botanical name is Piper longum, family Piperaceae. The ganas according to Charaka, Khasahara Varga, Kanthya Varga, Hikka Nigraha Varga, Asthapanopaga Varga, Triptigna Varga, Shiro Virochanopaga, Deepaniya Varga, Shula Prashamana Varga, Shita Shamana Varga. And according to Sushruta, it comes under Pipali Adi Gana. The vernacular names are in Hindi, it is called Pipali. In English, it is long pepper. Coming to the Rasa Panchaka of Pipali Moola, it is Katu Rasa, Tikshna Laghu Snigdha Guna, Anushna Virya, Madhura Vipaka, Kafavata Shamaka in Dosha Karma. And the karmas are mainly are Deepana, Rasayana, Vrishya, Rechaka, Swasahara, Kasahara, Jwarahara, Kushtagna, Pramehahara, Arshogna, Shula Nashaka, Krimigna, Gulmahara. The Amrika Prayoga of the Pipali are in Shula, it is used with Pipali plus Shunti and the remedy for the Udara Shula caused by the Kapha. And it is used in Chardi, that is Pipali plus ghee. Honey and sugar are very useful in the vomiting. And the third disease is Krimi. Kashaya prepared with Pipali Moola plus Gomutra, useful in the Krimi. Moving on to the third drug, that is Erenda. The botanical name is Ricinus communis, family Euphorbiaceae. The ganas is in Charaka, it is Bedaniya Varga, Svedopaga Varga, Angamarda Prashamana Varga. In Shushruta, Vidari Gandhadi Gana. And the vernacular names in Hindi, it is Endi or Erenda. In English, it is known as castor plant. Coming to the Rasa Panchaka of the Erenda, it is Madhura Katu Kashaya Rasa, Tikshna Guru Snigdha in Guna, Ushna Virya, Madhura Vipaka, Tridosha Shamaka, that is the Dosha Karma. And the main karmas of the drug is Shula Hara, Shota Hara, Jwara Hara, Kushtagna, Vrishya, Bhedana, Krimigna, Basti Shula Hara, Mutra Kricha Hara. The Amrika Prayoga of the Erenda are, it is used in Amavata. Erenda Taila alone will cure the disease. The Amavata, like how lion kills big animals like elephants, and the reference is that. Coming to the next disease, that is Vibandha Erenda Taila, which is very common and it induces the purgation. The third one is Shula, Kashaya prepared out of Erenda Moola and Shunti mixed with Hingu and Suvarchala will relieve the Shula, that is colic, immediately. Coming to the last drug, that is Shunti. Botanical name is Gingiber officinale. The family is Gingiberaceae. According to Charaka, it comes under Triptigna Varga, Arshogna Varga, Deepaniya Varga, Shula Prashamana Varga, Shita Prashamana Varga, Stanya Shodhaka Varga, and according to Sushruta, it comes under Pipali Adigana. The vernacular names in Hindi, it is Adraka, in English, it is ginger. The Rasa Panchaka of the Shunti are Katu Rasa, Lagu Snigdha Guna, Ushna Virya, Madhura Vipaka, Vata Kapahara in Dosha Karma. The main karmas are Deepana, Pachana, Vrishya, Swarya, Kasahara, Swasahara, Shulahara, Grahi, Rucha, Hridaya, and Vibandhahara. Coming to the Amayika Prayoga of Shunti, Agni Mandya. In Agni Mandya, Shunti Churna plus Haritaki Churna in equal parts has to be given with Guda in or with the Sandava. In Shotha, Shunti plus Guda in equal quantity added with Punarnava Kashaya is beneficial in the Shotha. Coming to the preparation of Chitraka Granthyadi Kashaya, the Chitraka, that is Chitraka in one part, Granthika one part, Erenda one part, Shunti one part. All the above mentioned ingredients are taken in the specified quantity and crushed into small pieces. Then times of water is added and boiled to prepare the decoction. When the water content is reduced to 1/4 quantity, the decoction is filtered and used. Coming to the doses and anupana, the drugs like Chitraka, Erenda, Shunti, Pipali, in all the useful part is MOOLA. And this can be taken with Hingu, Vidanga or Sandhava as an anupana. That is, Hingu is taken for the Shula, Vidanga is taken for the Anaha, and Sandhava for the Vibandha. The dosage is 15 to 30 ml with equal amount of water or two or three times a day, depending on the condition of the disease. The main indications of these formulations are Shula, Anaha, and Vibandha. And it is mainly given in the Sri Rogas, like Yoni Vyapat, Kafaja Yoni Vyapat, Upapluta Yoni Vyapat, in Acharna Yoni Vyapat. And that those are the lakshanas and the mode of action, how this drug acts. Ushna and Tikshna guna of drugs, Krimigna guna of the Pipali and Erenda, and Kandugna guna of Chitraka. In the same way, based on the Rasaguna and the Rasa Panchaka, the drugs act. Coming to the other Yonivyapats like Vataja, Udavartini, Pracharana, and Vipluta. In the same way, the lakshanas which I have mentioned and the mode of action of the particular drug in that disease. Coming to the particular indication in the Udavartini, here is the samprapti of the disease, that is due to Vegadharana vitiation of Vata happens, and the movements of the Vata in the reverse direction happens, which fills the yoni, pushes the raja upwards, and the discharge of the menstrual blood with difficulty, which is nothing but the dysmenorrhea. The probable mode of action of the Udavartini Yoni Vyapat. Vatahara property of all the drugs and Shulahara guna of Pipali, Erenda, Shunti relieves the pain. Vatanulomana property of Erenda does the correction of menstrual flow. This is the article related to the Chitraka Granthadi Kashaya. Conclusion: this formulation is effective in conditions like Shula, Anaha, and Vibandha. Discussion: all the dravyas are Ushna Virya, Katu Vipaka, and Vata Kapahara in nature. Thereby, they are helpful in treatment of Anaha, Shula, Vibandha. With particular Anupana shows the good results. This is the formulation which is available in the market. Thank you.
Thank you, doctor. So next I invite Dr. Deep Nayan.
Yes. Hello. Audible?
Yes, doctor. Doctor,
Yes.
please start.
Okay. Hello. Screen. Hello.
Doctor, screen is visible. You are audible. Please start.
Okay, ma'am. Yes, my name is Dr. Deepnayan Shinde, PG Scholar, Department of Panchakarma, PMP Ayurvedic College, Shevgaon, and guide name Dr. S.R. Gandhi. Next. Hello. Cardiac emergency in the most of the cases are fatal. Role of Ayurveda in the certain condition till date has remained to limit only, but it has been observed in the text that these types of condition can very well be managed on Ayurvedic lines. Most common cardiac emergency is myocardial infarction, an occlusion disorder leading to permanent damage to arteries. All the three treatises of Ayurveda describe that what is principal dosage to be vital. Hence, specifying Vata with promptly acting the medicine is required for managing the condition. Shuddha Hingu is one drug which can pacify Vata immediately and thus with a drug of choice. It is required to be studied with details and experimental data to prove utility of Ayurveda in the field of criteria care management. Investigation X-ray, ECG, angiography, echocardiography, radiological studies. Limitations may all asadhya condition mentioned in classics, congenital and hereditary heart disease, the condition which requires surgical investigations. रुद्रक चिकित्सा चरक के अनुसार वातज, पित्तज, कफज, त्रिदोषजन, कृमिज. ये चरक के टाइप्स है. वातज में स्नेहन, स्वेदन, मृदु वमन आणि बस्ती. पित्तज शीतद्रव्य लेप परिषेक मृदू विरेचन पित्तनाशक आहार विहार. कफमध्ये स्वेदन वमन लंघन जांगलदेश आहार लंघन लघु संतर्पण. कृमीज में लंघन पाचन स्नायु आहार मृदु विरेचन कृमिघ्न ड्रग्स. Angina pectoris correlated with root stool. As there is a radiating pain, it suggests the major vehicle of Vata. So we should go for Vata Rudra Chikitsa. Snehan, Svedan and Mrudu Vaman. शमन औषधीमध्ये रोगशृंग भस्म महावात विध्वंस सुवर्ण सुचेखर लक्ष्मी विलास रस. As per Charak, if shul is after intake of food, the shul असेल तर so the suvarna with water during digestion, virechan with dragsha. After digestion of food, snehan virechan with tela, continuous Ashtavadi virechan with danti mola and Triyutta. Coronary thrombosis, throat-wedge rudrok. It is obstruction in one of the branch of coronary arteries, which suddenly cut off the blood supply to myocardium and gives rise to myocardial infarction. Obstruction in branch of coronary artery is nothing but throat road, which can be occurred due to ventilation of all three doshas: Vata, dryness and roughness of vessels; Pitta, inflammatory changes in vessels; Kapha, thickening of coronary vessels. Treatment मध्ये the thrombus in coronary vessels has to be relieved by स्त्रोतावधन मार्गावर चिकित्सा. समान औषधीमध्ये हरितकी, अर्जुन, शतावरी. This might cause MI, which leads to shock for the ozonas. Chikitsa should be done. Nasya, Trikotu, Vakachurna, Matulunga Swaras. As acute phase is over, the treatment of Tridosha Rudrok should be followed. Langhan, Lagu Santarpan. Rheumatic heart disease, Amvata Rudrok, Amvitis Rasa, body fluid circulates all over the body. And Amajvar, rheumatic fever is called rheumatic fever while circulating with Rasa. This Ama accumulates with at endocardium and myocardium and pericardium respectively. Treatment में rheumatic fevers is Amajvar, मतलब comparison, myocarditis मांसगज्वर, endocarditis रस रक्तगज्वर, pericarditis मेदोगज्वर. सामान्य चिकित्सा लंघन, स्वेदन, दीपन, विरेचन, स्नेहपान, बस्ती, वृक्ष स्वेद, वालुका पोट्टली. शमन औषधी भल्लातकादी चूर्ण, आजमोद्यादी चूर्ण, फलत्रिकादी चूर्ण, सुंत्यादी वात, पिप्पल्यादी वात, अभ्यंगादी गुटी, आमातादी गुटी रसायन योग.
Yes, doctor.
Yes, ma'am. Okay. Cardiac arrhythmias, हृदयगती विकृती. संप्राप्ती, Vanvayu controls all activities of heart. Ventilation of Vanvayu, abnormal activity of the heart. Then don't type. Increases in kapha and increases in pitta. The increase pitta असेल तर tachycardia, increases in kapha असेल तर bradycardia. ट्रीटमेंट मध्ये ड्रग्स वर्किंग इन प्रतिकार्डिया, सुवर्णमाक्षिक, अहिफेन, बिल्व मूल, देवदारू. अँड ड्रग वर्किंग इन ब्रॅडिकार्डिया, नागवल्ली, तुलसी, कस्तुरी, कुचला. योगात बृहत्वात चिंतामणी रस, महावात विध्वंस. इन additional, the treatment of Vatas Rudrok should be carried out. Snehan, Svedana and Mrudu Vaman. Hypertension, blood pressure varies directly with the cardiac output. Peripheral vascular resistance, increases in peripheral resistance is due to spasm of arteries, Van-Vayu prokop. Coronary inflammatory disease of blood vessels, Pitta Vidrudi. Arteriosclerosis leading to thickening of blood vessels is due to Kapha Vidrudi. Disease of blood vessels in Ayurvedic classic, Dhamni Pratuchay, Siragraha and Siragat Vata. So while treating the hypertension with Ayurveda, one should be treat the increases in cough and pitta. As Vayu is responsible for activity, it should be treated. शमन औषधी सर्पगंधा डेकोटेशन ऑफ पुनर्नवा अमृत अधिक कुमारी शिलाजिता त्रिफळ गुगुल आमलकीमध्ये पित्त शामक आहे आणि रसायने ब्राह्मी पित्त शामक आहे आणि जटामांसी वात शामक आहे. योगात चंद्रकला रस सुवर्ण सुशेखर रस बृहत्पाद चिंतामणी. Arterial sclerosis, markavron is generalized phenomenon and depending upon the its site of manifestation, it may lead to different disorders. In limbs, vat rakta, hruday hridroga, shirasas vat vyadhi. Along with the specific treatment, the treatment of the markavron should be added. If treatment of markavron is not added, the respective diseases are likely to reappear. Treatment में वात कफ along with markavron should be done. Langan, snehan, svedan, mrudu vaman, लघु संतर्पण. शमन औषधी मेडिसिन acting on hypertension, cholesterol, arteriosclerosis. ताम्र, हिंगुल, यवक क्षार, टंकन क्षार, हरितकी, शुंठी, पिप्पली, देवदारू, शिलाजित, गुगुल. टॉनिक्स टू ब्लड वेसल्स, पुनर्नवा, यष्टिमधु, शतावरी, आमलकी, अर्जुन, गुळची, वंगभस्म. Treatment of markavron अभिषंध्याची चिकित्सा. The drug used should be स्नेह should be avoid abhishanda. The drug as well as food arteries should not aggravate cough or pitta, but should do Vatanuloman and Vatashaman. Chandra Prabhakar, what example? Srotoshodan चिकित्सामध्ये विरेचना समर्चन अनुलोमन as per the patient's bal oral administration. Chandra Prabhavati आणि Prabhakarvati रसायन चिकित्सा as all rasayan yogas along with Shuddha Shilajita and Shuddha Gugul as per matra with milk are beneficial or for Arutta Vata. Rasayana therapy specifies the abnormalities in dhatus and srotas. Shaman and Shodhan therapy distinguish the doshas. Dhatu Samarochan can't cure their injury. For this purpose, rasayan therapy is very much essential.
Hello, doctor.
Yes, ma'am. Something wrong. Something gets wrong, ma'am.
What happened, doctor? Is it the slide or?
Slide. Yes, okay.
Is it not in the order, doctor?
No. Doctor. Take. Hello.
Yes, doctor. Doctor, please.
Yes.
Can you please tell
Yes.
which is the next slide?
Yes.
Bypassing
the bypass. Research रसायन औषधीमध्ये यष्टी मधु गोक्षुर सुवर्ण अभ्रक मोर्कद भस्म शतावरी लवष्ण स्थौल्यदी चिकित्सा. It is seen that the most of the stool patients are prone for hridrog. Yomalak churna is said to be beneficial, reducing cholesterol and triglyceride level. Bypassing the bypass, research is carried out at JSS Ayurvedic Hospital, Mysore, in collaboration with the Seema Heart Foundation. Mysore found that changes in lifestyle helps in preventing major cardiac elements. Daily regimen for heart patients: brushing teeth with Triparapat, Tambul seven with Vataj and Kaphaj, Abhyanga oil massage, Vataj with Tila Tela, Pittaj with coconut oil, for Kaphaj, Udvartam with Tripara, Trikotu and Vacha is indicated. Snan bath in Vataj with warm water, in Pittaj with cold water, Kaphaj with hot water bath. Ornaments make mind pleasant, and exercise should be in Ardha Shakti. Yoga exercise, Shavasana, to relax body as well as mind. Padmasana and other meditating postures to relieve psychological tensions. Pranayam strengthens the heart and increases ability of tissue to utilize oxygen at low pressures. Sleep in Vatas and Pitas, heart disease more hours than normal. Also take sleep in afternoon. The Kapha's heart disease less sleep and avoid afternoon sleep. He can relax in sitting posture. Sex excess intelligence, then sex give rise to giddiness, exhaustion, weakness and loss of strength and wasting, preventing accumulation of waste product. One should regularly attend to his natural urges so that waste product don't accumulate in body. कपच प्रकृती प्रशूल वमन इन वसंत पित्तच प्रकृती विरेचन इन शरद वातच प्रकृतीमध्ये बस्ती विथ वॉटर सॉल्ट अँड ऑइल इन वर्षा अपत्य तैल आम्लतक्त गुरु अन्न कषाय रस अतिश्रम क्रोध चिंता शोक मैथुन should be avoided. पंचकर्म स्नेहपान पूर्णनवा पंचकर्म डिटेल्स वातच पुनर्नवा तेल पित्त जीवन त्यादी काकोल्यादी गण सिद्ध घृत द्राक्ष घृत स्नेह इन कृमिष में स्नेहयुक्त आहार अभ्यंग पंचकोलादी तेल पंचकोलादी स्वेदन निराग्नि स्वेद इन वातज एंड कफज इन पित्तज नो स्वेद.
Doctor.
Hello, thank you, ma'am. Thank you.
Yes. Okay, thank you, doctor. So
Okay, thanks.
next I invite Dr. Archana Haribau for the paper presentation. I invite Dr. Archana. Dr. Archana, are you there?
Yes, ma'am.
Doctor, please share the screen. Dr. Archana.
Yes, ma'am.
Doctor, please share the screen.
Something went wrong, ma'am. Not sharing my PPT.
So, doctor, please be there. You can present next. So, next I invite Dr. Dhyaneshwar.
Yes, ma'am.
Ma'am,
Yes.
give me 2 minutes only.
Doctor, it's already there is a delay. So, please be there. You can present next. So, next I invite Dr. Dhyaneshwar Digambar.
Yes, ma'am. Yes.
Doctor, please share the screen.
Yes, ma'am. एक मिनट. एक मिनट मैम. Yes, ma'am. Ma'am.
It's visible, doctor.
Yes, ma'am. So myself, Dr. Nyaneshwar Digamru Paljad, PG Scholar Shaletendra. My guide name is Dr. Seema Argiri. My topic of presentation is diabetic foot infection and courage management. Am I audible, ma'am?
Yes, doctor.
Abstract. Ulcer are a serious complication of diabetic foot mellitus, which increase the patient morbidity and also have significant socioeconomic impact. The present review aim to summarize the cause and pathogenesis leading to diabetic foot ulcer classification system and to focus on current management to this significant and preventable health condition. More than 25 million people in the United States are estimated to have diabetes mellitus, and 15 to 25% will develop a diabetic foot ulceration during their lifetime. Next, introduction. A foot with a constellation of pathogenic changes affecting the lower extremity in diabetes, often leading to the amputation and death due to complication. The most common initial lesion leading to amputation is non-healing skin ulcer induced by regional pressure, pathologically linked to sensory neuropathy, ischemic and infection. Aim and objective: define diabetic foot. Any infection involving the foot in a person with diabetic originating in a chronic and acute injury to the soft tissue of the foot with evidence of pre-existing neuropathy and ischemia. Pathophysiology: vasculopathy, neuropathy. In neuropathy, three nerves: sensory, motor, autonomic, and immunopathy. Vasculopathy, 30 times more prevalent in diabetics. Diabetics get atherosclerosis of obliterans and lead pipe arteries. Classification of the clinical media: endothelial changes, often increased blood flow with a lack of elastic property of the arterioles, not considerable to be primary cause of foot ulcer. Neuropathy: changes in the vasoneurosome with resulting ischemia cause, increased sorbital in feeding vessel, block flow and causes no ischemia. Intraneural complication of advanced product of glycosylation. Abnormalities of all three neurological systems contribute to ulceration. Sensor neuropathy: loss of protective sensation, start distally and migrate proximally in stocking distribution, large fiber loss, also small fiber loss. Motor neuropathy mostly affect forefoot ulceration, intrinsic muscle wasting and weakness, that is claw toe and hammer toe. Autonomic neuropathy: regulating sweating and perforating to the limb. Loss of autonomic control inhibits thermoregulatory function and sweating, result in dry, scaly and stiff skin that is prone to cracking and allow to a portal of entry for bacteria. That is picture of autonomic neuropathy. Patient evaluation: medical, vascular and orthopedic. That is medical evaluation: optimized glucose control and decreased by 50% of chances of foot problem. Patient vascular evaluation: assessment of peripheral pulse and amount importance. If any concern, vascular assignment, toe pressure, and expensive but helpful in amputation. Orthopedic: ulceration, deformity and prominence and contraction. Ulcer classification according to Wagner's classification: 0, that is intact skin; 1, superficial ulcer; 2, deep to the tendon, bone and ligament; 3, osteomyelitis; 4, gangrene of the toe and forefoot; 5, gangrene of the entire foot. Type classification according to see the picture: type 2 and type 3 Wagner's classification. Type 4 treatment: patient education, ambulation, show wear, skin and nail care, avoiding injury, that is hot water and foreign body. 6 intervention demonstrate efficacy in diabetic foot management: first, offloading; second, debridement and drainage; third, wound dressing; fourth, appropriate use of antibiotic; 5, revascularization; and 6, limited amputation. Treatment, that is dressing of diabetic foot. Prevention prevention मध्ये diabetic control and foot care. Indication for amputation: uncontrolled infection or sepsis, inability to obtain a plantar grade dry foot that can tolerate a weight bearing non-ambulatory patient. Conclusion: multidisciplinary approach needed, going to be an increased problem, high comorbidity and cost. Solution is probably in prevention. Reference. Thank you, ma'am.
Thank you, doctor. So next I invite Dr. Archana. Dr. Archana. Hello, Dr. Archana. Dr. Archana, if you are there, please respond.
Next, doctor.
Okay, so next I invite Dr. Neelam Mahadev for the paper presentation. I invite Dr. Neelam.
Yes, ma'am. 1 minute. Good evening, all of you. Myself, Dr. Neelam Mahadev Samre, PG scholar from Amritha Department, Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. On the occasion of Hair Disorder National Seminar, I am going to present a poster and a paper presentation having a topic name poster Autism Management in Ayurveda and paper presentation in Bal Sanskar in Ayurveda and its relation to developmental milestones. First, I will present poster on autism management in Ayurveda in children. Autism is a serious developmental disorder that impairs the ability to communicate and interact the child with the social environment. Autism is a neurodevelopmental disorder and also a behavior disorder. Autism spectrum disorder impacts the nervous system and affects overall emotional, social, and physical health. Child may experience behavioral, developmental, and psychosocial impacts on his life. As the causes are maybe genetic and medicine taking in pregnancy. One of the major causes COVID-19. In this, parents and children experience the social isolation during COVID-19 situation. ASD child face problems like motor difficulties, communication difficulties, repetitive behavior, social impairment, including signs and symptoms of low social interaction, less eye contact, prefer to be alone, playing alone, avoids physical interaction, etc. No specific treatment in available in modern science. So in Ayurveda, various therapies like Panchakarma therapy, speech language therapy, yoga therapy, meditation like pranayam, music therapy has a major impact in treating the autism. So medicinal therapy like mhetre rasayan, which includes mandukparni, yashtimadu, guduchi, shankhapushpi, brahmi, jatamansi, and sadhanastapan dravya like vacha, hingu are included in autism treatment. Main aim in Ayurveda in treating autism is Agnidipan and Dhatu Shodhan and also a Medhavardhan of the child. Thank you.
Thank you, doctor.
And next is paper presentation. Should I continue?
Please, doctor.
1 minute. My topic is Bal Sanskar in Ayurveda and its relation to developmental milestone. Samskaras are a series of sacraments, sacrifices, and rituals that serves as the rites of passing the mark the various stages of the human life and to signify entry to a particular ashram. All these rituals are of the nature of purification and gives good qualities of life. Samskar means gunantar adhanam, which is used to transform the qualities. Samskarohi gunantar adhanam. Keyword sanskara. Introduction. The word sanskar is derived from the root word kri and some upasarga, which is being used for a several meaning according to reference to content. The sanskara is used in a very wide senses with the in the sense of education, cultivation, and ornaments, purificatory rite, or a ceremony to change the qualities. In short, the sanskar means those religious rites and ceremonies which sanctify the body, mind, and intellect so the person may become fit for the society. In other words, sanskar means gunantara adhanam, which is used for transform the qualities. These sanskara are related to proper growth and developmental of fetus and child. Number of sanskaras varies from 16 to 40. In Manusmriti, there are 13 sanskaras. Objects are sanskaras aim in the first instant at material gain to the individual. Sanskaras also build a wakefulness of the attainment of social status and rights for the individual. Sanskaras bring about cultural gains, and the various ceremonies related to the sanskaras helps in the formation and development of the personality. In Ayurveda, the word sanskaras also introduced as sanskarohi gunantaradhanam, which qualitative improvement is carried out by incorporating the specific qualities, which is mentioned in Charak Samhita Vimanstan, first adhyay. There are 16 numbers of samskaras in 4 avasthas. That is, first is Garbhavastha Sanskar in prenatal period. Second, Balyavastha Sanskar in childhood, Yuvavastha Sanskar, and Vruddhavastha Sanskar. Garbhavastha Sanskar includes Garbhadan, Punsavan, and Simantonayan. In Balyavastha Sanskar, Jatakarma, Namakaran, Nishkraman, Upavesan, Karnavedan, Falaprashan or Annaprashan, Chudakarma, Upanayan, Vedaramba. And Yuvavastha Sanskar, Samavartan and Vivaha. In Vruddhavastha Sanskar, Vanaprastha, Sannyas and Anteshti. In Balyavastha Sanskar, there are 4 periods. First is during postnatal period, Jatakarma Sanskar, that is birth rituals at the time of birth. And the second is Namakaran, that is naming ceremony. In during infantile period, Nishkraman, that is outing ceremony, Upavesan, seating ceremony, Karnavedan, piercing the earlobes, Falaprashan, Annaprashan, that is feeding ceremony. During preschool period, Chuda Karma or Mundan Karma, that is shaving of head. During school age period, Upanayan, that is a sacred thread ceremony. And with Vedaramba, beginning of Vedic studies. First is Jatakarma Sanskar. According to Charak, after the cutting of umbilical cord, the infant birth rites should be performed. As per Acharya Charak, on first day, the birth, the child should be given first feeding of honey and grita concentrated with mantra. According to importance of Jatakarma Sanskar, rooting and sucking reflex as well as sucking, swallowing, breathing coordination is assessed while offering the honey and ghee. And also an efficient tool of examination to rule out the oral anomalies such as cleft palate, natal teeth, ankylosoma, etc. Namakaran Sanskar. On 10th day, Charak has given the detailed description of this ceremony. And in Sushrut Vagbhat, this ceremony should be performed on the 10th day after the birth. In Ashtang Sangra, it is performed on 10th day, 12th day, and 100th day, or after 1 year. Significance of Namakaran Sanskar. It is important tool for socialization. Name of baby promotes the healthy psychology, good physical and mental development. Name provides identification as well as social and personal recognition to the baby. Baby regains the first birth weight on 10th day after the birth. Next is Nishkraman Sanskar. This Sanskar is performed when the child is taken out of the home for the first time. Importance of this Nishkraman Sanskar is during after 4 months. During this ceremony, following development changes appears in infant. At 4th month, infant able to reaching out the objects with both hands, able to rolls over the bed, recognize the mother, responds to her voice, laugh loudly, and when talk to someone, respond to sound well, starts cooing, curious and shows interest in surrounding environment. Disappearance of grasping reflex, that is 3/4 month, placing reflex, stepping reflex are examined in this sanskar. Upaveshan sanskar, according to Kashyap, it should be done on 6th month. As per Kashyap, baby should not be allowed to sit for a longer time. But if not observed properly, then it develops kyphosis, weakness of lumbar region, fever, constipation, retention of urine, etc. Wagbhat stated that during the 5th month, the child should be placed on ground. Sushrut also opinion that child should be allowed to sit for a longer time gradually. Significance of this sanskar is, as per developmental milestone by 6th month, child is able to sit with support, tries to hold the things and put in the mouth. It gives opportunity to initiation of sitting and assess the physical, neurological and psychological growth of the child. Next is Karnavedan Sanskar. There are different views about performing this ceremony in Ayurvedic text. According to Sushrut, it is performed in 6 or 7 months. There is a chapter named Chudakarniya in Kashyap Samhita, which includes the Karnavedan Sanskar. Importance of these Karnavedan Sanskar are by Sushrut, the child ears are pierced for the purpose of Raksha Nimitta and Abhushan Nimitta. Falaprashan and Annaprashan Sanskar. In 6 months, Falaprashan is advised by Kashyap and Annaprashan is suggested in 10 months. Importance of this sanskar: at the age of 6 months, weaning from breast milk is done to fulfill the requirement of growing child. So, introduction of supplementary feeding is Falaprashan and Annaprashan. Chudakaran sanskar, that is Mundan sanskar. It involves shaving of the head. According to Sushrut, the cutting of hairs, nails gives the lightness, courage and happiness. Importance of this sanskar: diagnosis of Fakkarov, examination of infant, examination of skull for many defects or milestones. Upanayan sanskar. In this sanskar, Shishya instructions from his teachers while starting the study of Ayurveda, as in Charak and Sushrut Kashyap. This sanskar correlates with preschool age 3 to 6 years. In this significance of Upanayan sanskar, assessment of maturity of brain to perform intellectual activities during the school going age is done. Vedarambha sanskar. According to Acharya Sushrut, as the child acquires capacity, strength to learn and education should be started. This sanskar correlates with the school age 6 to 12 years. In this sanskar, each student according to his lineage masters his own branches of the Veda. Significance of Vedarambha sanskar is, sanskar provides religious cult, humility, self-control and acceptability with the society. Thank you.
Thank you, doctor. Next, I invite Dr. Archana. Dr. Archana. Dr. Archana, are you there? So next, I invite Dr. Nikhil Trayambak Raghu Patil for the paper presentation.
Yes, ma'am. Hello. Hello.
Yes, doctor, you are audible.
Okay. Let me share my screen.
Doctor, please share the screen.
Yes, ma'am. Just a second, ma'am. Zoom. Hello.
It's visible, doctor. Please start.
Oh. Good evening, everyone. Myself, Dr. Nikhil Kambakrao Patil, PG scholar from Dr. D.Y. Patil, College of Ayurveda, Pune. My guide name is Dr. Deepak Khawle, sir. I'm going to present my paper on Pathya and Apathya for children, immunity, and poster on role of Panchakarma in child lifestyle disorder. So paper presentation topic is Pathya and Apathya for children immunity. Ayurveda is a science which has given importance to diet and regimen as a part of Chikitsa. Pathya Apatya has a supportive role in the management of disease. In some stages of Vyadhi, following Pathya and avoiding Apatya is enough to cure the disease. Acharya indicated the importance of Pathya Ahar by stating that if a patient intake wholesome food, then there is no need of medicine. And if a patient continuously consumes unwholesome food, then also there is no need of medicine. In latter case, medicine will not be effective. Ahar is said to be Mahaveshaj by Acharya Kashyap. The ways to overcome to disease and maintain of a good health are the two main prayojan of Ayurveda. To maintain good health and to overcome disease, we need good Vedic samartha, that is immunity. Synonyms of Pathya are Satmya, Swasthya Hitakara, Upashaya, Hita Ahara, Swasthya Charjuskara, Sukha Parinamakara, Dhatu Samyakara. And synonyms of Apatya are Asatmya, Swastha Ahitakara, Anupashaya, Ahitakara, Dhatu Samyakara, Asukha Parinamakara. आहार मात्रा प्रधानतम मात्राशी साथ आहार मात्रा पुनरावृत्ति बलपेक्षिणी person should always consume food in proper quantity. Quantity of food depends upon the strength of digestive fire. Quantity of food consumed which gets digested without creating disturbance in normalcy of body and within the stipulated time, that should be considered as a proper quantity. Means a person who has the habits of consuming food in proper quantity daily, or the person who is inclined to consume food in proper quantity. Here the quantity is that which does not create any harm. Definition of Pathya. Pathya is that which is right path, which does not create any trouble and which is pleasant to the mind. That which is unpleasant to the mind is Apathya. This should not be neglected. The root term of Pathya is Patha, means various channel in body, and Nepatham means not causing any harmful for body channels, and on the contrary, which is wholesome, soothing for body, can be labeled as Pathya. Pathya means belonging to the way, suitable, fit for proper Pathya, salutary, and especially diet in medical science. Ahar and Vihar, which is not harmful to the body and body channels, is called as Pathya. Ahar and Vihar, which is helpful to whole body, is Pathya. The Pathya Ahar and Viharas, which is pleasant to the mind, is known as Pathya. Definition of immunity. The human body has the ability to resist almost all type of organisms or toxins that tends to damage the organ. This capacity is called immunity. Importance of Pathya and Apathya. The importance of Pathya and Apathya in Ayurvedic can be deduced from the fact that Charak had stated Pathya, a synonym for treatment. Charak stated that when channels of circulation become hard by aggravated and vitiated dosha, Pathya helps to soften the sprotasa and dosha elevation. Charak had elaborately described the concept of Pathya and Apathya. He had given a general list of Pathya and Apathya Dravya for patients. Charak had also given equal importance of Pathya Vihar along with Pathya Ahar for maintenance of health, as Charak has stated that in condition of Chinta, Shoka, Rodha, Dukha, Shayya, Ratri, Jagaran, Even the small amount of patyahar is not digested. Thus, having given equal importance of both patyahar and vihara. Further, Shushrut had specially written a chapter named Hita Ahita Adhyay in Sutra Sthana. Need of Pathya in children immunity. Pathya is suggested in various places in Ayurveda. It is very much necessary for the patients to have the food which will keep their dhatus in a healthy state and will not let them get vitiated more from doshas. Pathya is that which brings the vitiated doshas to normalcy, and apatya are those which cause vitiation and abnormalities in the doshas. Pathya kalpana increases Jatharagni, that is digestive power. Dhatu Samya have very much important role to develop immunity. Pathya Dravya for children to increase immunities are breastfeeding, Swarna Prashan, Dugdha, Ghruta, Madhu, Ashwagandha, Shatavari, Bala, Amlaki, etc. Thank you. So my poster topic is, hello. Hello.
Okay, doctor,
My
please
poster
continue,
topic
doctor.
is role of Panchakarma in child lifestyle disorder. So in today's era, everything is artificial. Even from the time of pregnancy, if you consider infertility, baby born with the help of IVF. If we consider pediatric age group, then consumption of junk food is at least 3 to 4 times a week, which leads to hormonal imbalance, which further leads to pediatric obesity, constipation, vitamin deficiencies, delayed milestone, delayed speech, etc. So for all these problems, we should use natural therapy. And the best natural therapy, as we all know, is Panchakarma. The main role of Panchakarma is to maintain the equilibrium of body. In pediatric age group, we can use Snehan, Swedan, Vasti, Vaman, Mridu Virachan, the, he- the, he- the healthy diet, which is Ahar and Vihar, is advised in Panchakarma as well. So if we do follow these things according to Panchakarma, then we can lead to happy and healthy life. Thank you.
Thank you, doctor. So next I invite Dr. Kalyani Mahesh for the presentation. I invite Dr. Kalyani. Hello, Dr. Kalyani.
Hello. Hello.
Doctor, you are audible. Please start.
Yes, ma'am. Is my screen not visible, ma'am?
Your screen is not visible, doctor.
Hello.
Hello.
Doctor, it's
Just
not
a
visible.
moment. Just a moment, ma'am.
हेलो मैम, कोई और भी बोल रहा है? हेलो.
Hello.
Hello.
Hello, doctor. Now I invited Dr. Kalyani.
Yes, ma'am. I will
Kalyani
share my.
Mahajan. So I
Dr.
think there is a
Kalyani Mahajan, please continue, Dr. Kalyani Mahajan.
Yes, yes.
Dr. Kalyani, please share the screen. Hello, Dr. Kalyani, please share the screen. Dr. Kalyani, am I audible to you?
Hello, ma'am. Can you please clarify Dr. Kalyani Mahajan or Patankar?
Doctor, now I just
Kalyani
invited
Mahajan.
Dr.
Kalyani
Kalyani.
Mahajan. Dr. Kalyani Mahajan, are you there? Dr. Kalyani Mahajan, can you hear me?
Doctor, I just now invited
Dr. Kalyani Mahajan.
Kumar Mahajan. So next I invite.
Okay, next.
Doctor.
Next, please,
I
doctor.
invite Doctor. Okay, Doctor. Next I invite Dr. Sri Shaila Swami. Dr. Sri Shaila Swami for the presentation. Sorry, there is a change. Sorry, there is a change. Next, I invite Dr. Mahadesh for the presentation.
Dr. Mahadesh Herman, are you there?
Sir, I will there.
Okay, doctor. Please share the screen,
Mahadesh.
doctor.
Hello.
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 Hello, Dr. Kalyani. Dr.
Hello.
Kalyani, please wait.
Sir,
Doctor,
I'm
we
not
will
able
call you
to
after
share my
minutes. Dr.
screen.
Mahadesh, please continue.
Dr. Kalyani, it's okay. Doctor, please be there. You can present later.
Dr. Mahadesh, please continue, doctor. Please share the screen, doctor. Dr. Mahadesh, please unmute, doctor. Dr. Mahadesh, please unmute, doctor.
Hello, Dr. Sabin.
Hello, sir.
Dr. Mahadesh. Doctor, please share the screen, doctor.
Doctor,
sir.
hello, Dr. Sabin. Can you please share the
Yes,
screen for Dr. Mahadesh?
Okay. Minute.
Sir, it's not working, sir. Sir, it's not working, sir.
Okay, doctor, 1 minute. I will share for you, doctor.
Okay.
Doctor, is the screen is visible, doctor?
Sir, visible. This one, sir.
Please continue, doctor.
Myself, Dr. Mahadesh Herman. My topic is assessment of the efficacy of Bhratvata Chintamani Rasa and Gagnadivati with Gandha Prasani Taila in the management of Akshata with special reference to hemiplegia comparative clinical study. Next slide, please. My guide and co-guide. Next slide. Need of the study. The Pakshagata is one among the Vata Vedi considered under Ashtamahagata, which is Sobhavata Dushchikista. When the greatly aggravated Vata inwards the Urdhva other Tiryagata Damanis, then it is destroys and any one of half of the body, which is called Pakshagata. But this affected side of the body becomes incapable of any work and becomes unconscious person may even lose his life. Pakshagata is explained in nearest or to cerebrovascular disorder called stroke hemiplegia. This disease may be caused either by dhatukshaya or due to margavarna apatarpana nidana causes the dhatukshaya and then lead to Vata Vadi. Contrary to this, Santarpana Nidana, like excessive consumption of unwholesome food in combination with lack of physical activities, cause morbid accumulation of the kapha and medas in the rasa dhatu and rakta dhatu. The morbid accumulation oblating the srotas term as a amarsa, as shown in the Abhishanda. Next slide, please. Next slide. Thus, obstructed srotas silently evaluated Damanis Partichaya leading to Margavarna. This pathology of Margavarna, when involves the Shiromarma, the patient may suffer from set of syndromes that include emerstones, squint, confusional state, paralysis, aphasia, dysthesia, aphonia, facial paralysis, dysphonia, etc. Among these, Pakshagata is the most common illness. Survey studies show approximately 60% stroke are due to ischemic, 20% of cerebral infarction, and another 20% rare brain hemorrhage. Further, community survey in India revealed that the prevalence rate of stroke in this range out of 1,200 persons, and this accounts of nearly 1.5% of urban hospital admission. If the affected individual is the only earning member, then the family has to face endless problems. Due to this, patient goes to extreme state of depression and frustration. In spite of recent technology development in brain imaging, neurological intervention, recovery is not satisfactory. Hence, the current study undertaken Gaganadivati and Gandha Prasanitaila with a provide efficacy of Prata Vata Chintamani Rasa, and ingredients of Gaganadivati are found to be Yogavaha, Balya, Uttama Rasayana. Gandha Prasanitaila is having Guru and Saraguna, Ushnavirya, Kappa, Vata Hara properties. Hence, it is going to be beneficial in the condition of Pakshagata. Next slide, please. These all review literature, and this is the review. Next slide, please. These are all modern review. Next slides, please. Drug review. These are drug review. Next slides, please. These are previous work done. Next slide. Objective of the study: to evaluate the therapeutic effect of Prata Vata Chintamani Rasa and with Gandha Prasanitaila, the management of Akshata hemiplegia, to evaluate the therapeutic effect of Gaganadivati with Gandha Prasanitaila in the management of Akshata hemiplegia, to evaluate the assessment of efficacy of Prata Vata Chintamani Rasa and Gaganadivati and with Gandha Prasanitaila in the management of Akshata hemiplegia. Next slide, please. Next slide. Hypothesis, null hypothesis. There is no significance of the effect of Prata Vata Chintamani Rasa and with Gandha Prasanitaila in the management Pakshagata. This is a null hypothesis. The alternative hypothesis: there is the significance and effect of Prata Vata Chintamani Rasa and with the Gandha Prasanitaila in the management Pakshagata, and there is no significant effect of Gaganadivati with Gandha Prasanitaila in the management of Pakshagata is the null hypothesis. But alternative hypothesis is that there is significant effect of Gaganadivati with Gandha Prasanitaila in the management of Pakshagata. There is no significant difference between effect of Prata Vata Chintamani Rasa with Gandha Prasanitaila and the Gaganadivati with management of Pakshagata. There is significant difference between the effect of Prata Vata Chintamani Rasa, the Gandha Prasanitaila, and Gaganadivati with Gandha Prasanitaila in the management of Pakshagata is the alternative hypothesis. Next slide, please. Materials and method. Source data. The source data is the collected source is literacy data will collected from the central libraries as well as Kachik's departmental libraries, SSRMS Inchel College. This is a clinical source is the collected SSRMS hospital OPD IPD cases, and drug source is collected from the raw drug collected from authenticated area. Then preparation did in SSRMS College in RSBK department. Next slide, please. Method and collection data. The study is clinically study, which is 40 patients will be selected to the basis of simple randomized sampling procedure according to inclusion criteria, selection criteria. Diagnosis criteria is the patient is clinical presented with chesta nivrutti, ruja, vak stamba, toda, stamba is affected side of the body, mukha vakrata, parva stamba, parva sankocha, dorbalya. Next slide. Inclusion criteria. The patients presenting with classical signs and symptoms, Pakshakata already is a diagnosed cases hemiplegia, hemiparesis with hemiplegic gait, with or without Vakstamba. Patient is group 30 to 65 years in the irrespective sex, religion, and socio-economic status and occupation. GCS scale is 13 and above. Mild to moderate hypertension, stroke with diabetic mellitus. 2 and left or right sided Pakshagata with or without Mukha. The next exclusion criteria. Exclusion criteria is lost bowel and bladder control, IHD and acute hemorrhagic disorder, diabetic mellitus first, and unconscious patients and space occupying the lesions of brain such as tumor and thrombocytopenia and GCS scale below 13. Next slide, please. Withdrawal criteria. Patient can get withdrawal from a trial anytime with the following reasons, as a case may be: health, safety issues, personal reasons, non-compliments, loss of follow, randomized error. Patient can shifted to higher center any time in case of emergency. Intervention. Group A admission 20 patient growth of the Chintamani Rasayana BD dose and oral with Gandha Prasanitha external application 28 days, and group B administration of Gaganadi oral BD dose with the Gandha Prasanitha external application in 28 days. And study design the comparative clinical study, and sample size is 40, grouping A and B, and total duration treatment is 28 days and follow-up 28 days. Assessment criteria, subjective criteria, change of the function and lower and upper extremity, change of the speech, chesta nivritti ruja in affected of the body in the Vakstamba, Todastamba, and the Supti and Mukha Vakata. Next slide. Objective criteria: strength, bulk, tone of the muscle, higher mental function, and deep and superficial tendon reflex and gait. And overall assessment: no relief in below 25%, mild relief 25% to 50% is improvement, moderate relief 50% to 75% is improvement, marked relief above 75% is improvement. Next slide, please. Statistical analysis. The data obtained in the group of will be recorded, tabulated, statistical analysis using appropriate test, student t-test. Thus, the study requires the investigation or intervention to be conducted on patients or other humans, animals. If so, please describe briefly, as this study will be conducted clinical or human beings investigations, RBS, ABC, PTINR, HB, and TCDC, ESR, CT scan. Has ethical clearance or been obtained from your institution, as the institutional ethical committee clearance certificate has been enclosed. Next slide. Next slide. These are all a reference. Thank you.
Thank you, doctor. So next I invite Dr. Archana Haribau. Dr. Archana.
Hello.
Yes, ma'am.
Ma'am, can I share my screen now?
Dr. Archana.
Yes,
Please wait, doctor. Dr. Kalyani, you can present next. Please be there. Now I invite Dr. Archana for the presentation. Dr. Archana, please share the screen. Please wait, doctor.
Dr. Archana, please
share
continue,
the-
doctor. Dr. Archana, please continue, doctor.
Yes. Good evening, everyone. I am Akshata Ayure, Department of Chikisis. My topic is to evaluate efficacy of Dashang to evaluate efficacy of Dhanyakadi Churna in the management of Amlapitta. Nowadays, Amlapitta is a very common disease in a society due to improper habits of food intake and hectic lifestyle. In modern science, there are a lot of formulas for Amlapitta, but it has no lot of side effects. And these are not cure Amlapitta completely, only suppress the disease, and ignorance is more. In clinical study,
Dr. Archana.
Hello, Dr. Archana.
Hello.
Doctor, please continue.
Hello, sir. I'm not
please
showing
continue,
my
doctor.
PPT, sir, on screen.
It's visible, doctor.
Yes. Yes, ma'am. Clinical study of patient Amla Pitta treated with Dhanya Kadi Churna, which contain Dhanya, Chandan, Musta, Yav. With Madhu, we found that Dhanya Churna reduced the symptoms of Amla Pitta and Agnivardan, Ampachan, also seen hence. It is observed that Amla Pitta can be cured by Ayurveda. Keywords: Amla Pitta, Am, Agni, Dhanya Kadi Churna, acid peptic disorder. Introduction. Ayurveda is an ancient system of medicine known to mankind for more than 500 years. Ayu means life and Veda means science. Thus, Ayurveda is a science of life. It is a valuable gift for human given by Lord Brahma and our ancient acharyas. Today, the lifestyle is completely changed as compared with the past. Likewise, are the habits of food intake. Most of the people are not able to follow the rules of Ahar and Vihar. As a state, many are having improper food habits like excessive use of spicy intake on inappropriate time, having food with a preservative, fast food, etc. Due to this alternation in the food and lifestyle, many people are suffering from the number of disorder of digestion and the resultant clinical condition. The most common digestive disorder is Amla Pitta. With the Pitta is increase, eventually Amla gun of Pitta increases and produce the Amla Pitta. In the pathogenesis of Amla Pitta, there is an increase in the Amla gun of Pachak Pitta, and this Amla Pitta does not perform its digestive function properly. Impairment of Agni leads to the inappropriate of digestion and metabolism, leading of Amla Pitta. There are two types of Amla Pitta, Urdhvak and Adhok, and three types of dosh bheda.
Dr. Archana.
Aims and objectives: to study the efficacy of Dhanya Kadi Churna in Amla Pitta. Objective: to study the effect of Iladi Churna on signs and symptoms of Amla Pitta. To compare the efficacy of Dhanya Kadi Churna and Iladi Churna in Amla Pitta. To study the Amla Pitta as per Samhita in details. Methods. Case: patient name XYZ as age 35 male farmer has come to our hospital. Diagnosis: Amla Pitta. Chief complaints: Tikta, Amlodgar, Hruday, Kantha, Dah, Aruchi, Kam, Avipak, Sardi. Past history: no major illness. History of treatment: taken modern medicine as a various doctor but temporary relief. Hetu: family history, Prakruti Kul Amla Pitta. आहार: कटु आम्ल रसात्मक आहार, मसालेदार आहार, अध्ययन इत्यादि. विहार: जागरण, दिवसवाप. संप्राप्ति: हेतु, सेवन, त्रिदोष प्रकोप. अग्निमांद्य: एनल विधता, पित्त प्रकोप, and आम्ल पित्त. चिकित्सा विवर्जन: drug review, to drug were administered in order to reduce Amla Pitta. Sign and symptoms: them, Dhanya Kadi Churna and Iladi Churna. The details of ingredients, indication to the mechanism of action, table number 1 and 2. Drug administration shown in table number 3. Result and conclusion, result and discussion. In Amla Pitta, there is a Shukta Pak of Ahar. Also, Pitta is elevated by its Dravya and Amla Gun. Hence, treatment should be contained Shit, Virya, Tikta, Madhur, Kashaya, Ras, drug having Pachak, Grahi, Pitta, Samyak, and Vatomlak action. Dhanya Kadi Churna contains Dhanyak, is a Laghu Gunatmak, Kashaya, Tikta, Madhur, Ras, Madhur Vipak, and Ushna Virya. Musta is a Laghu. Musta is a Laghu Ruksha Gunatmak, Tikta, Kashaya Rasatmak, Katu Vipak, and Shita Virya. Chandan is a Laghu Ruksha Gunatmak, Tikta, Madhur, Rasatmak, Katu Vipak, and Shita Virya. इंद्रजव इज अ लघु रसात्मक, गुणात्मक, तिक्त कषाय रसात्मक, कटु विपाक and शीतवीर्य. The probable mode of action of Dhanya Kadi Churna is a Pachakgrahi, Pitta Samyak and Vatanuloman action. Due to this, this we found good result in the patient of Amla Pitta. Dhanya Kadi Churna in 10 days. Conclusion, Amla Pitta is a Vyadhi due to aggravation of Amla and Dravya Guna of Pitta. Dhanya Kadi Churna is effective relief of symptoms and Amla Pitta. Dhanya Kadi Churna should be used in Samavastha. If you use proper drug in order achieve to Samprapti Bhanga, then we can get good result of Ayurveda drug in disease. Amla Pitta is curable by Ayurveda medicine.
Hello, Dr. Archana.
References. Yes, please stop, ma'am. Dhanya Kadi table number. द्रव्य गुण रस वीर्य विपाक आणि तोषकंठ कार्यकारमुक्ता. धान्य गुण लघु स्निग्ध रस कषाय वीर्य उष्ण विपाक मधु त्रिदोषात्मक. चंदन लघु वृक्ष रस तिक्त वीर्य शीत विपाक कटु. मुस्ता गुण लघु रस कटु वीर्य शीत and विपाक शीत कफ पित्त समाक. इंद्रजव गुण लघु रस तिक्त वीर्य शीत and विपाक कटु त्रिदोषग्न.
Thank you, Dr. Archana.
Thank you, doctor. So next I invite Dr. Kalyani Mital Kumar Mahajan. I invite Dr.
Hello,
Kalyani.
ma'am.
Yes, doctor, you are audible.
Yes, I'm just sharing the screen. Is the screen visible, ma'am?
Yes, doctor, visible, doctor. Please continue, doctor.
My name is Dr. Kalyani Mahajan. I'm BMS MS Stri Rog Evam Prasuti Tantra from Sumati Bhai Shah Ayurved Mahavidyalay, Pune. My topic is Rakta Pradar. Acharya Charak has mentioned that Garbha can be recite only in Shuddha Yoni. That is why Ayurveda has explained women's health and in details and emphasized and all the preventive as well as curative measures to preserve in the healthiest way. Different types of gynecological disorders are discussed in Ayurvedic text under the common headings of Yoni Vyapat and Arka Vyapat. Rakta Pradar means excessive excretion of menstrual blood, either in quantity or in duration, has been explained in Charak Sahita Madhav Nidan. It is analogous to abnormal menstrual bleeding. Abnormal uterine bleeding is defined as any variation from normal menstrual cycle, and it includes changes in regularity and sequences of menses, in duration of the flow, or in the amount of blood loss. It is a problem mostly prevalent in productive age group worldwide and affects quality of the life. Now, menorrhagia means cyclic bleeding at normal interval, which is either excessive in amount, that is more than 80 ml, or excessive in duration, that is more than 7 days, or it can be both. The term dysfunctional uterine bleeding was specifically used when menorrhagia is not associated with any genital tract abnormalities, general or endocrinological diseases. Ayurvedic view of the disease Rakta Pradar. It is the disease which is characterized by excessive loss of blood during menstruation. The disease has been termed the Rakta Pradar, etc. at different places. Beside Asrubdar, few other conditions such as Rakta Yoni, Raktaj Artav Dushti, Raktaj Artav Dushti, Artav Ati Vruddhi have excessive cyclic or cyclic bleeding have also been described in Ayurvedic classics. While diagnosing the Asrubdar, it has been differentiated from this different condition. The ancient view regarding the disease, the definition of the word Rakta Pradar or Asrudar were given by various authors are given as below. Acharya Charak said that Pradar is a disease, and Acharya Madhav has explained local contributory factor for the disease, which blood comes in excess amount. Acharya Madhav's opinion that Asruk or Rakta, when discharged in excess amount per vagina, the disease is known as Asrudar. According to Acharya Vagdat, when blood either during menstruation or intermenstrual period comes, it is called Asrudar, Pradar or Raktanta. According to Dhallan, even less amount of blood that can be seen during intermenstrual period or duration of intermenstrual period shortens the Ayurvedic prescriptive disease is termed as Asrudar. Now, classification of the disease according to Charak, Madhav Nidan, Bhava Prakash, Yog Ratnakar, Rakta Pradar is classified into four types: Vataj, Pittaj, Kapach, and Sannipataj. According to Dhallan, Asrudar is classified into seven groups: Vataj, Pittaj, Kapach, Vata Pittaj, Pitta Kapach, Vat Kapach, and Sannipataj. Now, what are the causes of the disease? Excessive use of lavan, excessive use of acidic materials that is amla, excessive use of guru that is heavy, excessive use of katu, the substance which cause burning, meat of wild animals, meat of aquatic animals, rice cooked with meal, curd, shukta, mastu, these all. In Bihar, excessive traveling, excessive walking, excessive weight lifting, sleeping in daytime. Local factors are garbha, abortion, and excessive coitus, mhetre. And the general factors are digestive disorders and injury. Now, Samprapti, the Vayu getting aggravated during the above mentioned causes reaches Raktava Srotas of Garbhashay. The increased amount of Rakt within the vessel mixed with the Raj, that is menstrual blood. Naturally, the amount of Raj increases suddenly, and this increase in amount is mainly its Rasvaha. This increased Raj, when excreted through during menstruation, comes in excessive amount. Samanya Lakshan of Rakta Pradar, according to Charak, is excessive vaginal bleeding during menstruation is the only symptom of Asrudar according to Charak. According to Shushruth, body ache and pain present in all type of Asrudar with excessive bleeding per vagina. According to Dhallan, burning sensation in lower portion of groin, pelvic region, back and the flanks, and severe pain in uterus as symptom present in Ashrut Vriddhi. Sadhya Asadhyata, prognosis is bad in cases of Sannipataj Rakta Pradar and in cases where there is continuous bleeding per vagina associated with thirst, burning and fever, etc. Less amount of blood in the body and weak ladies. Differential diagnosis of Rakta Pradar, Pitta Jyoni Rapid. In Pitta Jyoni Rapid, menstrual blood is yellowish black in color, excessive in amount, hot, and it smells like dead body. Punapagandhi, producing burning situation of the yoni, and it is associated with fever and heat. Asruj Yoni Vyapad, there is excessive bleeding per vagina after conception. Adhogat Rakta Pitta, there is excessive bleeding through vagina, rectum, or through urethra. This may be considered to be a cause of various bleeding disorders such as thrombocytopenia, etc., or as puerpera. Lohita Yoni Vyapat, there is insider sudden irregular bleeding. This can be correlated to cervical lesions like erosion, polyp, fibroid, etc., causing bleeding. Paripluta Yoni Vyapat, there is excessive bleeding with pain all over the pelvis. It occurs during drushti of Pitta and Rakta dosh. This condition can be correlated with chronic pelvic inflammatory disease. Now, treatment of Rakta Pradar. According to Charak, the predominance of dosh is Vata. In Vata Jyoni Rog, Snehan, Swedan, and Basti Chikitsa. Pitta Jyoni Rog, use of sheath material with other treatment of Rakta Pitta to stop the bleeding. Kapha Jyoni Rog, hot and dry things should be used. In Sannipata's treatment should be given according to predominance of dosh. The principal treatment of Rakta Pradar is Nidan Parivarjan, Dosha Shodhan, and Dosha Shaman. In Nidan Parivarjan, this is the main principle which include identification of cause and steps of its eradication.
Dosha
Hello, Dr. Kalyani.
Very remote chance. Hello. Hello.
Yes, doctor.
One.
Please continue, doctor.
Hello.
Doctor, in between the presentation, your voice is breaking.
Oh, sorry, ma'am. Due to network issue, may I continue?
It's okay, doctor. Please continue.
Thank you, ma'am. It is very important part of Ayurvedic Chikitsa. Once Shodhan is done, there is very remote chance of reoccurrence of disease. Normally, the Shodhan Chikitsa is considered as a use of Panchakarma Chikitsa with Purva Roop, but this therapeutic procedure is contradicted in delicate women and weak person. The women suffering from Rakta Pradar usually become weak due to loss of vital substances, mainly blood of the body. Naturally purifying measures are not prescribed. Another procedure termed as Lekhan Karma or curate, which is also a type of cleaning procedures. Basti Prayog, among the five main Shodhan Chikitsa, Basti contributes majorly, and that is the reason why it is known as Ardha Chikitsa. There are various types of Basti mentioned in Ayurveda, but it's mainly used to achieve balance in Vadush. Basti is nothing but enema of herbal oils and decoctions, or both. There are many formulations mentioned in Ayurveda following and are mainly used in Rakta Pradar Chikitsa, Rasnadi Asthapan Basti, Chandanadi Niruha Basti. Then Vaman Prayog. This is one of the most important Shodhan Chikitsa which mainly applies for those diseases where cause of the dosha dushti is cough and predominance of cough doshas present. Then dosha shaman. In this procedure, treatment is given according to predominance of dosh. In another word, it is a symptomatic treatment. Then rakta sthapan. The treatment is given to stop the bleeding. Charak has mentioned a long list of drug of rakta sthapan. Churna is one of the highly reputed drug for the treatment of Rakta Pradar. Similarly, Pradhanantak Law Prabal Bhasma, Shalmali and Laksha Churna can also be prescribed and it is highly efficacious. Then Dravya and Kalpa, drugs for external use. Solanum suratans grown in the northern direction and uprooted during Uttar Falguni Nakshatra, the rooted tied around the waist cures Rakta Pradar. The drugs for internal use Kashai, Pradaraha Kashaya, Asrubdara Kashaya, Pathya Amalkyadi Kashaya. Then Kalka and Churna includes Rasanjon and Lakshan Churna taken with goat's milk, Kalk of Tandalaki Moola with Madhu or Rasanjan with madhu and rice water. Pushanak Churna. Content of Pushanak Churna are Patha, Jambu, Amra, Shilajit, Rasanjan, Mocharasa, Kesar, Ativisha, Musta, Bilva, Lodra, Gairika. This also can be used. Anupan of this is honey followed by rice water. Then Jirak Avleha can be used. All these drugs can be used. Thank you.
Thank you, doctor. So next I invite Dr. Vijay Kumar Mali for the presentation.
Good evening. Hello.
Good evening, doctor. Doctor, your voice is breaking.
Hello, ma'am. Can you hear me?
Yes, doctor.
Hello.
Hello, doctor.
My screen is visible, ma'am.
No, doctor, it's not visible. Doctor, it is not visible. Doctor, please unmute.
Dr. Vijay, can you hear me?
My screen is visible.
Your screen is now visible, doctor. But your voice is breaking, doctor. Please start the session, doctor.
Hello.
Hello, Dr. Vijay.
Doctor, it's visible. Please start.
Okay, Dr. Vijay has some network issues. Next, I would like to invite Dr. Kalyani Padankar for the paper presentation. Dr. Kalyani, are you there? Dr. Kalyani Padankar, are you there?
Hello, Dr. Kalyani.
Okay. Next, I would like to invite Dr. Sri Shaila Swami. Dr. Sri Shaila Swami, are you there?
Hello, Dr. Sri Shaila Swami. Dr. Sri
Okay.
Shaila Swami.
Okay, next I would like to invite Dr. Anusri for the paper presentation. Dr. Anusri, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Okay, sir. Hello? Hello?
Hello, doctor.
Yes, doctor.
Is my screen visible?
Not visible,
No,
doctor.
Now?
No, doctor, not visible.
Sir, can you share?
Okay, doctor, 1 minute. I'll share for you. Doctor, please start the session, doctor.
Good evening, all. Myself, Dr. Anushree CG from Agada Department, PG Scholar, SDM College, Hassan. My presentation topic is Sanjeevana Agada in the management of Vishya. Next slide. These are the contents. Next slide. So, introduction. Sanjeevani Agada is one in which life of an individual is regained. As Amrita gives life even to the dead person in the same way, Sanjeevani Dravyas works. It is used in the form of Gutika and it cures all types of Visha. In Ramayana, it is said as it is a powerful herb for snake bite, and it is seen in Sundara Kanda. When Rama and Lakshmana were encircled with the snake, they were treated with drugs present in Sanjeevani Parvata. Next slide. References are from Sushruta Kalpasthana 5th chapter and Ashtanga Sangraha Uttarasthana 40th chapter. Next slide. Next, ingredients. Next slide.
According to Sushruta, Laksha Harenur Naladam Priyanguhu, Shigrudvayam Eshtika Prutvikascha, Churnikruto Ayam Rajani Vimishro, Sarpir Madhubyam Sahito Nidayaha. Next slide. So according to Ashtanga Sangraha, Chandana Kunkuma Kushta Kankshi Laksha Priyangu Musta Shaileya Rochana Madana Fala Sri Veshtaka Vidanga Ela Vishala Hingu etc. All these drugs are said. Next slide. So according to Sushruta, these are the drugs: Laksha, Harenu, Nalada, Priyangu, Shigru. Next slide. Eshtika, Prutvika, Rajani. Next slide. So now we'll see about the Rasapanchaka. According to Sushruta, in Madhura Rasa, these drugs comes, that is Nalada, Priyangu, Eshtika, Prutvika. In Tikta, Harenu, Nalada, Priyangu, Shigru, Rajani are mentioned. Laksha, Nalada, Priyangu are mentioned under Kashaya Rasa. Next slide. In Katurasa, Harenu, Shigru, Prutvika, Rajani comes. Next slide. In Gunas, Laksha, Harenu, Nalada, Shigru, Prutvika, Rajani are said to be Lagu. Priyangu, Eshtika are said to be Guru, are having the Guru Guna. Harenu, Priyangu, Shigru, Prutvika, Rajani are having Ruksha Guna. Next slide. Laksha, Nalada, Eshtiku are having the Snigdha Guna and Shigru is having the Tikshna Guna. Next slide. In Virya, Harenu, Shigru, Rajani are under Ushna Virya. Laksha, Nalada, Priyangu, Eshtika, Prutvika are under Shita Virya. Next slide. Vipaka, Eshtika is having Madhura Vipaka. Laksha, Harenu, Nalada, Priyangu, Shigru, Prutvika, Rajani are having the Katu Vipaka. Next slide. Dosha Karma, in Kapha Pitta Hara, Laksha, Priyangu are having the Kapha Pitta Hara property, and Harenu, Shigru, Prutvika, Rajani are having the Kapha Vata Hara. Nalada, Eshtika, Tridosha Hara. Laksha, Shigru, Prutvika are Deepana, Pachana, Dravyas, and Laksha, Nalada, Rajani are Kushtagna. Next slide. And this Shigru and Prutvika are having the Hridya property, and Vishagna and other karmas are mentioned like Vishagna, Krimigna, and Vranaropana, Lekana, and Vritasanjivana. Next slide. Now method of preparation and indication. Next slide. According to Sushruta, all the powdered drugs mentioned in this Agada are made into paste with madhu and gruta, and it should be preserved inside the cow's horn and covered in the above manner, and this medicine is called as Sanjivani Agada. Next slide. According to Ashtanga Sangraha, Chandana, Kunkuma, Kushta, Priyangu, etc., all these drugs should be collected during the Pushya Nakshatra and made into paste, and it is used as Agada. Next slide. Administration, according to Sushruta Kalpa, it is administered as Pana, Anjana, and Nasya. According to Ashtanga Sangraha, Pana, Nasya, Anjana, Dhuma, Lepana, and Dharana. In this form, it can be given. Indication, it is, according to Sushruta, it is capable of restoring even a man apparently dead to life. Next slide. According to Ashtanga Sangraha, it restores the life of a person who is unconscious by the effect of poison, and it brings victory in King's Palace, and it is auspicious. Next slide. And it brings happiness, wards off inauspicious hymns, fever, artificial poison, evil spirits, and it wards off demons, wild animals, harmful insects, worms, reptiles, destroys sight of terrifying objects in dreams, enemies, thieves, etc., likely to be present in the house, prevents premature death, epidemics, effects of thunderbolt, etc. Next slide. Discussion. Next slide. So here Madhura Rasa is having the 50% and Tikta Rasa is 62.5% and Kashaya Rasa is 37.5% and Katu Rasa is having the 50%. Lagu Guna is 75%, Guru Guna is 25%, Ruksha is having the 62.5%, Snigdha is having the 37.5% and Tikshna Guna is having 12.5%. Virya, Ushna Virya is 37.5 in this Sagada and Shita Viryas are 62.5. And in Vipaka, Madhura Vipaka is 12.5% and Katu Vipaka is 87.5%. Next slide. Dosha Karma, Kapha Pitta Hara is 25%. Kapha Vata Hara is 50% and Tridosha Hara is 25%, Deepana is 37.5% and Hridya is 25% and Kushtagna is 37.5%. Next slide. So in total, we can see that Tikta Rasa is 62.5%, Lagu Guna is 75%, Shita Virya is 62.5%, Katu Vipaka is 87.5% and Kaphavata Hara is 50%. So this Tikta Rasa is mainly Vishahara, Krimigna, Murcha Prashamana, Daha Prashamana, Kandugna, Kushtagna, Jwaragna, Deepana. Lagu Guna, it easy to digest. Shita Virya, it is it gives firmness and it is Pitta Shamaka. Katu Vipaka, it subsides the Kapha and it normalizes the Pitta according to Charaka. Next slide. Conclusion. So it contains, according to Sushruta, it contains 8 drugs. Shigru is of 2 varieties. It cures all types of visha and regains life of a person. It gives long life, prosperity, destroys evil spirits, epidemics. It is having Tikta Rasa, Lagu Guna, Shita Virya, Katu Vipaka, Kaphavatahara. So we can give Sanjeevana Agada in all case of visha. Thank you.
Thank you, doctor. So next I invite Dr. Kalyani. Dr. Kalyani. I invite Dr. Kalyani Mahesh Patankar.
Yes, ma'am. Just a second, I will share my screen. My screen is visible.
Yes, doctor, visible. Please continue, doctor.
Okay. Myself, Dr. Kalyani Mahesh Patankar. I am MD scholar of Saswata Department, KC Ajmera Ayurvedic College, Dhure. My guide is Dr. Varsha Jaraje, Associate Professor of Saswata Department, KC Ajmera College, Devpur, Dhure. My topic of presentation is Yoga and Diabetes Mellitus, Recommendation and Benefits. Introduction. Yoga is a psychosomatic spiritual regulation of attaining union and synchronization between our mind, body, soul, and definite unison of our individual realization and universal realization. Yoga forms an essential part of our mind body strategies to encourage excellent physical condition and well-being, which takes amount of relaxation procedure, hypnosis, visualization, feedback, meditation, breathing exercise, conjunctive behavior therapy, and spirituality. These all strategies are based on researches into association and connection between the nerve, immune, and endocrine system, all of which make up source of psycho-neuro-endocrino-immunology. The use of alternative adjuvant therapy is based on substantial from clinical investigation and researches, and currently there is inadequate concept comprehensive medical and systemic review in the existing literature and concentrate on effective and significance of yoga practices in diabetes mellitus management, as type 2 diabetes is a fast becoming one of the foremost disabling disease globally. The present literature review was aimed to assess the effectiveness and physical effect of practicing yoga on type 2 diabetes mellitus. Materials and methods. In order to provide a general overview and understanding, appropriate article on a physiological effect of yogic practices include pranayam from journals, books, and online publication were reevaluated, and list of references for each of the relevant studies was searched. Full text of relevant article was retrieved for further assessment to draw fruitful conclusion. Various asanas recommended in diabetes mellitus. Surya Namaskara. It energizes neurogranular and neuromuscular system of body, ensure balance supply of oxygenated blood, thus the strengthening entire psychosomatic system of human body. Vajrasana, it is conductive, stabilize body mind, improve digestion, circulation, along with strengthening thigh muscle. Pavan Muktasana, it is effective in muscular alignment, remove indigestion, build powerful abdomen. Padmasana, induce mental calmness and tranquility, helps to relieve the constipation, improve digestive process, and tone coccygeal and sacral nerve by supplying them the extra flow of blood. It helps to keep vein, bile, and phylum in proper position.
Dr. Kalyani?
Ma'am, my screen is disabled. Just a second.
Doctor, it's visible.
Is it visible to you?
Yes, doctor.
Visible, doctor. Screen is visible.
Ma'am. Okay. Padmasana, it induces mental calmness and tranquility, helps to relax sacral nerve by supplying them extra flow of blood. Paschimottanasana ensure proper circulation of blood in whole body, stimulate digestive organ, encouraging regular bowel movement, and relieving constipation, regulating working of pancreas by massaging abdominal organ. Halasana, related to endocrine gland, mainly thyroid gland. Sarvangasana, regenerate entire body, tone up endocrinal gland, helpful in DM. Matsyasana, helpful in DM, menstrual flow become regularly normal. Bhujangasana, which helps in massage abdominal organ, influence kidney and adrenal gland, more effective for dyspepsia, tone ovaries and uterus. Shalabhasana, good for blood circulation, bring large supply of blood to kidney and other organs, thus cleaning and regulating them. Stimulating whole ANS, particularly parasympathetic. Dhanurasana affects entire abdominal region. Liver, pancreas are made to work in sound manner. Padahastasana, in digestion, remove excess fat from abdomen. Ardha Matsyendrasana, stimulate gastric secretion, liver, pancreas, and spleen disorder. It compresses element, canal, and almost all viscera. Sarvangasana, it intense the rejuvenate body, mind, and spirit. Study supporting the role on yoga and DM. Regenerating the cells of pancreas due to abdomen stretching during yoga exercise and may increase utilization and metabolism of glucose in peripheral tissue, liver, adipose tissue through enzymatic process. Regenerative of pancreatic blood cell occur by yoga exercise that promotes the blood circulation in the region of pancreas. Fasting blood sugar, serum total cholesterol, LDH, VLDL, and ratio of total cholesterol from HDLC, total triglycerides, were significantly lower, and HDLC significantly higher. In a study involving 20 patients by type 2 diabetes mellitus were subjected to 30 days of yoga routine by an expert. The posture performed were Surya Namaskarsana, Trikonasana, Tadasana, Padmasana, Bhatsrika Pranayam, Paschimottanasana, Ardhamastendrasana, Pavanmuktasana, Bhujangasana, Vajrasana, Dhanurasana, and Shavasana. At the end of 30 days of performing the asanas, study of the participant had been significantly decreased in fasting BSL level, V-step ratio, and beneficial changes in insulin level. Psychological effect. The metabolic effect of practices of asana, pranayama, meditation synchronizes with other physical effect and contribute by physical effect, fitness and sense of well-being. It will practices over the period of time. It considerably reduce the metabolic rate due to decreasing sympathetic nervous system actively. Yoga has developed its holistic approach to combat the work-related stress, anxiety, and depression in its epoch of modernization and exacerbation. Stress activates the oxidation process of membrane of lipid level and distribute the membrane and causing the release of oxygen at the tissue level by relieve hypoxia. Thus, the tissue hypoxia plays important role in pathogenesis of cardiovascular disease and diabetes. High level of stress lead to increased cortisol level, which cause mobilization of fatty acid from fat store and lead to higher level of abdominal fat. In anxiety disorder, the increase of thalamic GABA level observed after yoga practices explain the improvement in anxiety disorder, depression, and multiple sclerosis, where the lower GABA level were found. Physical and mental stress causes rise in BP and increased capillary hydrostatic pressure, facilitating the flow of plasma from vascular compartment to the interstitial compartment. Thus, the rising blood vascularity in capillaries, which is cardiovascular risk. Pranayama alleviates stress and decreases cardiovascular risk in DM. Yoga practices over the prolonged period cause significant drop in level of blood sugar level, glycate, hemoglobin, and rise in hemoglobin, improvement in posture, circulation, BMI, and contribute the sense of as well-being. Discussion. This review focused the beneficial effect of yoga on diabetes mellitus. Yoga is, as a mind-body therapeutic approach, is gaining the greater administrator and recognizing the convention medicine as a holistic practice aimed towards the achieving health. Pathophysiological cause of DM in general is insulin resistance caused due to obesity and improper secretion of or absence of secretion of insulin hormone due to chronic or uncontrolled case of type 2 diabetes mellitus. Specialized causes include stress and lack of sleep due to various lifestyle modification. Asana, which initiated the secretion of insulin hormone, can be adopted. Twisting movement of yoga helps in squeezing insulin out of pancreas, thus the helping in treating diabetes mellitus. Asana and pranayama increase nerve conduction velocity, reverse decline in conjunctive brain function, release stress and mental fatigue, strengthening the limbic system. Hence, the asana which reduce stress is also recommended in diabetes mellitus. Summary: various yoga posturing or physical posture are especially useful to reduce fat in various parts, improve blood circulation of internal organ and strengthening them, stimulating the endocrine gland. It shows marked improvement in following criteria: metabolic effect, decreases the blood sugar, lipid, cholesterol level, and nitrogen in urine, increase protein in blood, so psychological effect, mentally fit and stable, decrease mentally fatigue and stress, balance between sympathetic and parasympathetic nervous system, alpha waves increases, reconducting in neuromuscular, reticular and limbic system, thereby health and immune system. Conclusion: the review article haven't report any adverse effect of yoga practices. Any form of exercise can reduce abdominal fat, but the uniqueness of yoga is to alleviate the stress. It is effective and incomparable. It is highly effective in early onset of disease and supportive or accessory treatment in chronic and uncontrolled case of type 2 diabetes mellitus. A definite recommendation is needed to encourage the patient to practice yoga. It can be administered as an alternative therapy to the standard lifestyle intervention. References and thank you.
Thank you, doctor.
Thank you, doctor. So next I would like to invite Dr. Vijay Kumar Mali. Hello, Dr. Vijay, are you there? Dr. Vijay Kumar Mali. Dr.
Hello, ma'am.
Vijay, please unmute. Doctor, can you please share the screen?
Sir, can you share my PPT, please?
Okay, doctor. 1 minute, doctor. Doctor, please start the session, doctor.
Okay, sir. Good evening, all. My name is Vijay Kumar Navnath. I'm PG scholar from Gomantaka Ayurveda Mahavidyalaya, Goa. My guide is Basil Cardisor. My title is Patya Patya in Grahani Vyadhi. Introduction. In Ayurveda, Ayu is defined as conjunction of body, soul, mind, and senses. Each has been given due importance in maintenance of health and prevention and cure of disease. Balanced diet are key to good digestive health. But in current era, faulty dietary habits, sedentary lifestyle, and stress are main causative factors of disease. People eat lot of junk food and highly processed foods with preservative and contribute significantly to maldigestion and grahani. All these disturb the function of digestion and absorption that leads to many digestive disorders of the gastrointestinal tract. Aim of diet plan. There is nothing else except diet for sustaining the life of living being. One is capable to make man disease free only with the congenial diet. It is also true that both the conditions, health and disease, and wholesomeness and unwholesomeness is a prime factor throughout. Without proper diet, the use of drug is a failure. The aim of diet in persons suffering from grahani can be stated as an enhancement in agni can improve the functioning of grahani, correlate in bowel habits in terms of volume and consistency as prakrit, improvement in overall nutrition, prevention and reduction in complications, Properties of ahar dravyas for grahani. Laghu and grahi dravyas. Next slide, please. Hello.
Hello, doctor. This is next slide, doctor. Hello, doctor.
Hello,
Hello,
Dr.
Dr. Vijay.
Vijay.
Hello, Dr. Vijay. Can you hear me? Hello,
Dr.
hello, Dr.
Vijay.
Vijay. Can you hear me? Okay. Next, I would like to invite Dr. Sri Swami. Hello, Dr. Sri Swami, are you there? Hello, Dr. Sri Swami, are you there?
Hello.
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 Doctor, please share the screen, doctor.
Yeah, sir. Okay, I will share the screen, sir.
Hello.
Hello. 1 minute, sir. ಅವನಪ್ಪ ಇಲ್ಲಿ ಯಾಕೋ ಇದೇ ಆಗ್ತಿಲ್ಲ ಇದು.
Dr. Sri Swami.
Hello.
Doctor,
Hello.
you have any problem with screen sharing, doctor?
Sir. Yeah, sir.
Hello.
1 minute, doctor. I will share for you, doctor.
ಏನಪ್ಪ ಇದು
Dr. Sri Swami, I will share for you, doctor.
Yes.
Doctor, please start the session, doctor.
Yes, sir. Yeah, myself Srishal S. Kanvimat. I'm from Department of Kaya Chikitsa. Sir, next slide. Yes, I'm briefing about AMA. Is the immature nutritional essence formed in due to the sluggish digestion, Amavata. The disease is formed due to the vicious amalgamation of morbid Vata dosha and Ama. Sir, next slide. Nidana, Viruddhara, mutually incompatible foods, Viruddha Cheshta, unwholesome lifestyle practices, Mandagni, having low metabolism and sluggish digestion for a longer period, Nischala, sedentary life activities, Snigdha Bhojana Vyayama, consuming unctuous, oily and high caloric food and immediately getting indulged in exercise. Sir, next. Chikitsa Sutra, reference Chakradatta Amavata Chikitsa Adhikara 1 to 2 shloka. Sir, next. Langana, first line of treatment for Amapachana. Agnidipana, with Tikta and Katu Rasatmaka Dravyas, example Trikatu, Shunti and Panchakola. Swedana, Ruksha Sweda like Valuka Sweda over affected joint, relieves Shula and Stabdata. Next. Sir, next slide. Shodhana, Virechana, for Koshta Shodhana as a Purva Karma for Basti, or as a complete Shodhana, administered frequently as and when required. Snigdha Virechana, Eranda Taila with equal quantity of milk. Sir, next. Basti, Kshara Basti or Vaitarana Basti. For example, Nirva Basti, Madhu, Saindavalavana, Broth Saindavadi Taila, Ajamoda Kalka, Eranda Mula Kashaya, Gomutra or Gomutra Arka, Chincha Guda Jala, Anuvasana Basti with Broth Saindavadi Taila. Sir, next, sir. Shamanaushadi, Simmananda Gugulu, Amavatari Rasa, Amruta Gugulu, Rasna Saptaka Kashaya, Rasna Panchaka Kashaya, Ajamodadi Churna, Trikatu Churna, Panchakola Churna. Ara Vyar, Patya Ara, Lagu and Ushna Ara, processed with Panchakola, Trikatu and Shunti. Apatya Ara, Abhishandi like Dadi, Ati Snigda, Ati Madura, Guruhara. Patya Vyahara, regular Vyayama, Ushna Jala Snana. Apatya Vyahara, Divaswapna, Avyayama, Ati Vyayama after Snigda Guru Bhojana. Sir, next slide. References from Shushu. Thank you, sir.
Thank you, Doctor. Next, I would like to invite Dr. Vinudha GM for the paper presentation. Dr. Vinudha, are you there?
Sir, I am there. 1 minute.
Okay, Doctor, please share the screen, Doctor.
Sir, can you please share me the slide, sir? I'm unable to share.
Okay, 1 minute, Doctor. Dr. Vinudha, please start, Doctor.
Okay. Good evening, everyone. My name is Vinudha GM from Department of DRAVYA from Ayurvedic College, Koppa. So first slide, please. I have taken the study like critical analysis of Shamahara Gana Mahakashaya. First, we'll know about concept of Shama. Here our Ayurveda tells that Swastasya Swastarakshanam Aturasya Vikara Prashamanam. Here the concept of Shama will also go both in Swastha and Atura. We all know when we do exercise and when we exhaustion work, we'll get a fatigue or a Shrama that is called as physiological fatigue. And when we have a suffering from any disease also, we will get a fatigue. We are unable to do the work that we can be considered as a pathological fatigue. When we go into the Acharya's meaning of Shrama, in Shabda Kalpadruma, it is said the word derivation of Shrama is like Shrama and Dhagdhatu. It means Tapa Kedaha. Here, any physical action can be considered as Shrama. When we go into the see the Paryayas of Shrama, that is Klama, Klesha, Parishrama, Vyayamaha. These are the 4 Paryayas which are given in Shabda Kalpadruma. Here, first, Klama means Yaha Anayasuho Shramaha, means if without doing any work we'll get a klama, that is called as Anayasaho Shramaha. That is Klesha means dukkha. When we get over fatigue, we'll feel like mentally weak. That we can consider as a Klesha. Parishramaha, Paritaha Shramaha, when we do excess physical action. Vyayamaha, we all know Sharira Ayasa Janya Karmaha, means after doing our exercise, our muscles get muscle get worked, fatigue, and that can be considered as Shramaha. These 4 can be considered as concept of Shrama. Hello.
Sorry, Doctor. Please continue, Doctor.
Okay, sir. When we go into these synonyms, when we look into these synonyms of Shrama, by
Hello, Dr. Vinita. Hello, doctor.
When we go, sir, next slide, sir, please, sir. When we look into, thank you, sir. When we look into like Shama serves as a nidana, and it can be
Hello, Dr. Vinita.
Bagandhara, Rudroga, Gulma, one nidana. And when we Shrama Nigrahana, we addition characterized by lessened capacity for work and reduced efficiency of accomplishment, usually accompanied by a feeling of weariness and tiredness. Means it's a lessened capacity of our body or our physiological system. See, there are two classifications of fatigue. That is, it may be a physical fatigue or it may be a mental fatigue or physiological fatigue. Or first we'll understand what do you mean by physical. How we understand? See, if we do any work, muscle needs energy for any work, which utilizes glucose. That is, which utilizes glucose, and it is under aerobic respiration. When we do excess work, when we put our body into excess work, our muscles will undergo into anaerobic respiration. Then there is accumulation of TNF, that is tumor necrosis factors, and interleukins, roserins, etc. These these will be accumulated in our body. Our immune system will be compromised, and we are unable to do simple work also. Then this will lead to a pathological fatigue. This is the pathology. It is beautifully explained in Ayurveda. That is Shrama leads into a Dhatukshaya. Dhatukshaya leads into a Ojakshaya, then Balakshaya and Shramakshaya, and that will Balak leads into a Shramashraya. Means if he doesn't supply, means needful energy after exercise and all, he will that will lead to into a Dhatukshaya. Otherwise, if he is suffering from any diseases, that is unable to do the work, that will lead to a Shrama. This vicious cycle is beautifully explained in our Ayurveda. When we see into this, there is a need of finding a drugs for the Shramahara. Hence, our Charakacharya has explained 50 Mahakashayas in Shadvirachana Shatashati Adhyaya. That is, Kashayanam Yatokta Dravyanam Kalpanam Oghyartam Samskaranam Kashaya Kalpanam. Why this? Here, Mahakashayas are like the group of drugs are taken which are having similar qualities, and they are put into in Charakacharya, he's also already said that this is for Alpa Buddhi persons, because he has already prepared food for us. These drugs can be acting on for these like Deepaniya, Pachaniya, like this. In that, Shamahara Mahakashaya is also one of the thing. That is Draksha, Karjura, Priyala, Badara, Dadima, Falgu. Sir, can you please change the slide, sir? Shamahara Mahakashaya. Next slide. Next, sir. Next. Okay, sir. Shamahara Mahakashaya. These are the 10 drugs of Shamahara Mahakashaya. Like this, Draksha, Karjura, Priyala, Badara, Dadima, Falgu, Parushaka, Ikshu, Yava, Shashtikashali. One of the beautiful beauty of this Shamahara Mahakashaya is all our fruits. We all know fruits we will use in our daily fruits, but so many are not known, means botanically which are the source. That's why I have put the figures here. That is, first we'll go in detail about one drug. That is Draksha. That is botanical names goes like Vitis vinifera. we'll know what are the main points. That is in English we'll call it as grapes. There are a beauty of the Shramahara Mahakasha is every fruit has having almost 10 to 12 varieties because they are widely in use. That is the synonyms of Draksha goes like Gostani, Gucha Phala, Palottamam, Swadu Phala, and in Charaka it is considered as Snehopaga, Virechanopaga, in Sushruta Kakolyadigana, Parushakadigana. That is, there are 15 to 20 varieties of grapes in our market. That is, these are some varieties like we can see. Sir, next slide, please. Sir. Next slide. Sir. These are some varieties like Moondrops, Sweet Jubilee, Concord, Champania, Chrisman. These are some varieties of grapes. Sir, can you please share next slide, sir? Next drug is Kharjura, that is Phoenix sylvestre. That is, here there are almost 20 to 22 varieties of Kharjura. That is Mejdal, Halwai, next Hayana, Diglet. These are some varieties. Next Priyala, that is Buchnania lanza. Sir, can you please share the slide, sir? That is Preenati, Tarpayati, Lati. Grapes and dates you may be knowing, but these are the rare picks which I have put here. That is Buchnania lanza. Here Badara. Sir, next, sir. Next.
Dr. Sabin, next slide.
Next slide. Hello. Okay. Hello.
Hello, doctor.
Sir, can you please Badara, sir? Next slide.
Doctor, slide is in Badara, doctor.
Okay, sir. They are not coming, sir.
I think it has some network issues for you, doctor.
Okay.
Doctor,
that is I'll continue, sir.
Okay.
Badara, next slide, sir. Next one. Badara, that is Jijupus jijuba. That is we all may come across in childhood. We have eaten this Jijupus jijuba. All may have eaten. There are n number of varieties in Badara. Next, these are the types of some Badara which are classically explained in Rajanigantu. That is Sauvira, Kola, and these are some varieties. Next, Dadima, we all know Punica granatum, which will be eaten and which will be prescribed by a doctors for iron increase in iron in many blood decrease in level, HP decrease level, and anemia patients. Next is Falgu, that is Ficus carica. Varieties of the fig, which can be fresh also eaten and dried figs are also eaten. Next Parushaka, that is Grevia asiatica. Next Ikshu, we all know this Sahacharam officinalim. Next Yava, Hodram vulgae. In North India, it is more used Yava compared to South India. And Shastikashali, that is Oryza sativa. When we look into all the Shramahara, include that these answers. Sir, next slide. Next slide. Next.
Thank you.
Okay. This is the slide. Rasa Panchaka will conclude that Rasa is Madhura and all are Madhura and Kashaya Rasa. Next, Guru and Snigdha Guna. Virya is Shita. Vipaka is Madhura. When we look into all the karmas are Balya, Vridhya and Krishnahara. Doshagnata is Vata Pitta Kafagna, Vata Pitta Shamaka. When we look into the phytoconstituents, like major components are of these all fruits are carbohydrates and proteins, and micronutrients are vitamins and electrolytes. Antioxidants, they are all these 10 drugs are like antioxidants, which decreases the free radical level in all diseased persons, which will contribute to well-being of the patient. Next, when we see into the nutritional assay, all the 10 fruits are rich in calories and mainly carbohydrates and dietary fibers, and they are rich in vitamin B6, folic acid, rich in electrolytes like potassium, magnesium, which is these electrolytes will play very much role in when we are in fatigue conditions. When we go in next slide, sir. when we look into the scope of this Shramahara Mahakashaya, these Mahakashayas drugs can be used like nutritional supplements and energy booster drinks, immunomodulators, as they are very well scoped in sports medicine and rejuvenation. They can be included in Rasayana drugs, and like for young children, they can be used as nutritional supplements. When at last take home message is, we always know that prevention is better than cure. It is said in Samhita that ahara sambhavam vastuhu rogacha ahara sambhavam hita visheshastu vishesho sukha dukhayoho. Means these Shramahara Mahakashayas are included in our food only. If we take these drugs as in our daily included in our food, we can prevent our body from a fatigue, and we can increase our energy levels. Hitashi syat mitashi syat kale boji ditendriyaha pashyan rogan bahun kashtan buddhiman visham anashat. Means we should know the quantity what we are eating. That's why I have put this list. Arogyam bojanam madinam. By these things we can know that, like, if we include these our 10 drugs in our daily life, we can prevent our fatigue and induce disease induced fatigue, also fatigue induced disease. This is the take home message. Thank you. Thank you, sir.
Thank you, doctor. So next I invite Dr. Ghanshyam G. Pandey. I invite Dr. Ghanshyam.
Hello, I'm audible?
Yes, doctor.
Okay. My slide is visible?
Your screen is visible, doctor.
Okay, fine. Here I start. Ashtanga Yoga for
Doctor, your screen is visible, not your presentation. Please click on the file, doctor.
One second.
It's visible.
Now is visible?
Doctor, please start.
Okay.
Yes, sir.
Here I start. The topic is that Ashtanga Yoga for enhanced living. In this, there are Ashtanga Yoga. There is the 8 type of Yam, Niyam, Asana, Pranayam, Pratyahar, Dharana, Dhyan, Samadhi. In short, we tell that introduction of Ashtanga Yoga. In Sanskrit, there is a Ashtang in Ashtang. In a short, it means there is a 8 limbs. Actually, this is pronounced by the Patanjali. And in history, there is a yoga has a root about the 5,000 years of British Christ, as described in a Vedic philosophy and Tantras. Patanjali, great. In short, there is a Patanjali are described as the yoga. Nothing else. 8 limbs of Ashtanga Yoga. Yam means the principle of non-violence. In this subtype are Satya, Satya, Brahmacharya, and Aparigraha. Satya means we know that the principle of truthfulness. Asatya means that not stealing. Brahmacharya means services, and Aparigraha means the principle of non-possessiveness. Niyama means discipline. This contains the Sauch, Santosh, Tap, Swadhyaya, Ishwar Pradhan. There is a another one is the asana. Asana means that there is a posture, a stable and comfortable posture which helps to attain the mental equilibrium. There is a different types of asana. We are not going to detail, but it is a basic type of asana. There is a pranayama also. There is a yogic breathing, extension and control of breath, and pratyahara. Pratyahara withdrawal of sense, a mental preparation to increase the power of mind. Dharana means that a concentration on an object, the concentration of mind on one object and its spirit. Dhyan is a meditation. Meditation is a major part in yoga and all in Ayurveda also. With the drowning mind of all external objects and the focusing it on the point and meditating on it. Samadhi is the last one copied on the Ashtanga Yoga, that is in the state of super bliss. In this condition, you are a union between the Jivatma and Paramatma, union of Shiva and Shakti in Sanskar Chakra, means Sahasrara Chakra, the top of the head, realizing that the pure consciousness. Main part is that Ashtanga Yoga and Ayurveda. I mean, what is the actual meaning of Ashtanga Yoga in Ayurveda? Until the unless the person cannot overcome from the accumulation of the chittam, mind, and not get control over his buddhis, intellect, he cannot get the tattva gyan. This is the reason why the yoga darshan advocate the Ashtanga Yoga. There are the yam, asana, niyam, pranayam, pratyahar, dharana, dhyana, and samadhi. And the first four are considered as the external method of purification, and the last three are the internal method of purification of mind. In between, the pratyahara act as the bridge of the between both external and internal path of it. Description of the same are present in Ayurveda in various concepts, either in the form of Sadritta, Achar Rasayan, Swasthavritta, Dinicharya, Chikitsa Sutra, etc. Following is the description of Ashtanga Yoga described in the Yoga Sutra of Patanjali, along with the reference of the same in Ayurveda. Thank you.
Thank you, doctor. So next I invite Dr. Deepshikha Sitaram. I invite Dr. Deepshikha.
Hello.
Hello, doctor.
Am I audible, ma'am?
Yes, doctor.
And let me share my screen, ma'am. Just a minute. Hello.
Hello, doctor.
Can you share my PPT for me? I am unable to share my screen, please.
Okay, doctor. Dr. Sabin. Dr. Sabin.
Okay, doctor. 1 minute, doctor.
Okay, sir.
Doctor, can you send me the PPT in my WhatsApp?
Yes, sir. I am mail and WhatsApp.
Doctor, can you please send one more time?
Okay, ma'am. Just a second.
Okay, doctor. So please be there. You can present next.
Oh, okay, ma'am. Okay.
So next I invite Dr. Nikhil Shyam Sundar Agarwal. Hello, Dr. Nikhil. I invite Dr. Nikhil Shyam Sundar. So next I invite Dr. Nabil Ashra Shakil. I invite Dr. Nabil. So next I invite Dr. Sinchan. I invite Dr. Sinchan.
Hello, Dr. Aishwarya.
Yes, doctor.
Dr. Deepshika's PPT is ready. Can you please
Okay,
call Dr. Deepshika?
Yes, sir. Yes, sir. I am ready.
Okay, doctor, I share the screen, doctor.
Okay, sir.
Doctor, please start the session, Doctor.
Okay. Thank you, sir. Hello, everyone. I am Dr. Deepshika Rakhunde from Assistant Professor from DRAVYA Department, Shri Ayurved Mahavidyalaya, Hanuman Nagar, Nagpur. My topic is importance of preservation and conservation of medicinal plants. Next slide, please, sir. Medicinal plants. Let me introduction. Medicinal plants are very important in every decade, important for treatment and prevention and cure also. Increasing due to increasing industrialization and big residential creation, it's from the current scenario. From the ancient century, the Ayurvedic medicines are used in various diseases. Next slide, please, sir. Ayurvedic medicinal drugs are more important. The conservation and preservation of traditional medicines are also more important. These are conserved and preserved by various techniques, that is plantation of various medicinal plants in garden area, at home, or in open land also. Next slide, please. These are some techniques, that is cloning technique, gene replication technique, DNA cloning in various laboratories. Because of this, our next generation by generation, they have also taking benefits of all these traditional medicines and live long and healthy life. Next slide, please. Need for conservation. Next, please. To support sustainable development by protecting and using biological process, collection, propagation, characterization, evaluation, disease indexing, and elimination, storage, and distribution, integral part of biodiversity conservation, that is in situ and in ex situ conservation. Next slide, please. Important plants that need us, that is, next slide, Acorus species, sweet flag, Aristolochia bracteata, that is Kirmar, Atropa acuminata, that is Indian belladonna, Berberis aristata, that is Indian berberry, Brumium persium, that is Kala Jira, Comifera vitae, that is Gugul, Coccineum franicidum, Jivanti, Ferula jacksonea, Indian hing. Next slide, please. Inula racemosa, that is Pushkarmul, Lilium polyphyllum, Kshir kakoli, Nordostachys grandiflora, Jatamansi, Picoraza curo, Kutki, Ravelfia serpentina, that is Sarpagandha, Swertia chirata. These are some plants which are going to conserve. Next one, conservation techniques. Next one, please. Germplasm technique for conservation, especially those with recalcitrated seeds in live gene bank in field, possess tremendous problem in terms of required land space. In vitro storage eliminates the need for long and frustrating quarantine procedures during movement and exchange of germplasm. Disadvantages of germplasm is the most economical means of germplasm storage. For seed propagated species, it is in the form of seed. Next one, please. This technique is not feasible because crops do not produce viable seeds. Seeds remain viable for a limited duration only in certain species deteriorate. Seeds are very heterogeneous. Next one, please. Next technique is cryopreservation technique for conservation of plants. The viable freezing of biological material and their subsequent storage at ultra low temperature, that is -196 degrees centigrade, using liquid nitrogen. The features of this, next please. Chemical inert, relatively low cost, non-toxic, non-flammable, readily available. Next one, please. National Cryobank and Genetic Conservation. National Cryobank at NBPGR has responsibility to conserve desiccation sensitive seeds, vegetative tissue, pollen, and selected orthodox seed species. Next technique is tissue culture technique used for conservation. Cell suspension, harvested, cryopreservation, dispense, storage, thawing, and regrowth. The importance of these, that is medicinal plants are used for various purposes, for treatment, prevention, and cure. It is important to save the plants who are going to disappear. Various techniques are used for the same. The conclusion is to initiate and support for conservation, management, and sustainable utilization of medicinal plants, promotes the conservation of threatened species of medicinal plants and their habitats for livelihood security through conservation of wild medicinal plants. Thank you.
Thank you, doctor. So it's going to be an end of today's session.
Hello, ma'am.
Hello, doctor.
Ma'am, Dr. Vijay is here. Can I continue my PPT?
Sure, doctor.
Okay, sir. Can you share my PPT?
Dr.
Okay, Dr. Vijay,
Sadia?
1 minute.
Sorry, there was network issue.
It's okay, doctor.
Okay, doctor. Please continue, doctor.
Sir, second slide. Okay, sir. Thank you. We are seeing Patya in Grahani Vyadhi. आहार वर्ग जार मांस वर्ग, शाक वर्ग and गोरस वर्ग, शुकधान्य वर्ग, शमीधान्य वर्ग, हारित वर्ग, कृतान्न वर्ग, इक्षु वर्ग, मध्य वर्गाज, फल वर्गाज, आहार योनी वर्गाज. A detailed description as below. शुकधान्य वर्ग. Next slide, sir. शुकधान्य वर्गाज पथ्य, षष्टिकशाली and पुराणशाली. अपत्य is Godhum and Yava. फल वर्गास पथ्य is डाळिंब, रामफल, बिल्व, wood apple, jambu. अपत्य is द्राक्षा, Indian jambu and नारिकेल, coconut. मांस वर्गास पथ्य is Indian titir, type of fish, lava, and शाक वर्गास पथ्य is चांगेरी. अपत्य is काकमाची, spinach, wild spinach. हरित वर्गास पथ्य धान्यक, महानिंब, अपत्य शिगरू, जिंजर, लसूण. मध्य वर्गास पथ्य सुरा, type of fermented drinks. धान्यम अपत्य is धान्याम्ल and सौवीर. गोरस वर्गास पथ्य is curd, milk, ghee, buttermilk. अपत्य is milk, मस्तू. इक्षु वर्गास पथ्य honey. अपत्य is madhur, a type of honey, and jaggery. आहार योनी वर्गास पथ्य is तिळतैल, जीरक, and अपत्य is क्षार. Importance of takra in grahani. Next slide, sir. Ayurveda mentioned about the uses of takra in the management of grahani, since does deepen and it is lagu to digest, thus helping the manage of what.
Dr. Vijay? Hello, Dr. Vijay? Dr. Vijay?
Hello, Dr. Vijay. Can you hear me? Okay, Dr. Aishwarya.
Okay, doctor. So it's officially now comes to an end of today's session. So we'll continue tomorrow. Till now, good night all. Thank you for your active participation. Thank you all.